No puedo compartir la pantalla, doctor
Ah,
Norville.
le estoy convirtiendo como host para que pueda compartir.
Mm,
Al momento que lo convierto en host, seguramente van a ver quienes se conectan. Ahí, por favor, les da también admitir. Ya,
Oh,
un host.
ok, ok. Estoy conectada de dos dispositivos. No sé si al otro dispositivo me puede dar voz, porque al de aquí, que estoy en la computadora, no puedo conectarme.
Sí, sí, sí. Voy a poner en el otro, entonces le voy a dar admitir y hacer host. ¿Mm? ¿Me confirma, por favor?
Mm. Sí, ya está.
Sí.
Bien. Bien, vamos a hablar un poco acerca de los avances y desafíos de la enfermería ocupacional en Latinoamérica y en Perú. Si bien es cierto, nosotros tenemos que enfocarnos a la importancia de la enfermería en salud ocupacional, cómo ha ido avanzando, cómo actualmente nos encontramos, ¿no? Nuestra intervención no solamente se va a limitar a la atención clínica, nosotras vamos a ir más allá como enfermeras ocupacionales, vamos a abarcar la parte preventiva, la parte de riesgo, la parte de educación, ¿no? Que siempre nos han ido enseñando y reforzado durante toda nuestra etapa profesional. De acuerdo a la Organización Mundial de la Salud, nos hablan de los entornos saludables que son esenciales para garantizar el bienestar físico, mental y social de los trabajadores. Asimismo, la Organización Panamericana de la Salud resalta que la labor de los profesionales de enfermería resulta una estrategia para consolidar ambientes laborales seguros y sostenibles. Entonces, es ahí donde nosotras como licenciadas en enfermería entramos a tallar. Somos importantes dentro de todos los equipos de profesionales de salud y no solamente en la parte ocupacional. Asimismo, dentro de los avances de la enfermería aquí en América Latina, pues nos hemos dado cuenta que hemos venido creciendo. Quizás no como se espera, pero estamos avanzando, ¿no? Hay un reconocimiento del rol de enfermería en varios países, por ejemplo, en Brasil, en México, Colombia, Chile y Perú. Las enfermeras ocupacionales ya son consideradas una pieza clave para la gestión de riesgos laborales, para la vigilancia de la salud y la promoción del bienestar en el trabajo, ¿no? También se ha dado una expansión académica y formación especializada. Nosotras comenzamos a liderar con programas de posgrado, de especialización en salud ocupacional. Asimismo, hay mayor presencia en los sectores estratégicos. Hoy por hoy solicitan enfermeras ocupacionales en el sector minería, en el sector hidrocarburos, en el sector manufactura, y gracias a ello pues se ha impulsado la contratación de enfermeras ocupacionales, ¿no? Y eso es clave para nosotros. Siempre va a ser clave, ¿no? ¿Por qué? Porque nos abre más campo laboral. Entonces, y eso quiere decir que estamos potenciándonos como profesionales de enfermería. Bien, también las normas laborales han impulsado un rol importante en la cual manifiestan que varias empresas pues deben tener las enfermeras ocupacionales. Entonces, eso también hay una parte legal, normativa, que nos está avalando, ¿no? Ahora, también es importante que nosotros como colegas a nivel internacional y nacional podamos pues ver ¿Cómo está acá en Perú? ¿Cuál ha sido este avance en la salud ocupacional? ¿Cómo se da, no? Por ejemplo, les comentaba hace un momento que hay una mayor inserción laboral. Según el MINSA, el Ministerio de Salud, aquí en Perú, el 35% de las empresas con más de 100 trabajadores en Lima cuentan con enfermeras ocupacionales en su equipo. Y eso es súper importante, porque más pasa el tiempo, más nos vamos afianzando y haciendo crecer nuestro campo laboral, ¿no? Las normativas en la pandemia se dio la normativa de COVID, preventiva para COVID, en la cual decía que todas las enfermeras deben trabajar en empresas, ¿no? Y nos abrió ese campo laboral y nos reforzó, no solamente como un campo laboral adicional, sino económicamente nos posicionó, ¿no? Hoy por hoy, una enfermera ocupacional dentro del estándar salarial, pues se encuentra muy bien, ¿no? Es una de las especialidades aquí en Perú donde son mejores pagadas, ¿no? Asimismo, el COVID aperturó más allá a nosotras como enfermeras. Hay colegas aquí en Perú que tienen empresas que brindan asesorías a otras empresas en materia de seguridad y salud en el trabajo. Asimismo, también brindan capacitaciones a otros profesionales, tantos ingenieros, médicos, enfermeras, entre otros, ¿no? Entonces, ¿qué tanto nosotros hemos crecido aquí en Perú? ¿No? Como colegas, como enfermeras, nos hemos repotenciado, ¿no? Y somos varias que actualmente contamos con estas empresas y pues trabajamos en la parte gestión y también prevención, ¿no? Si bien es cierto, tenemos que considerar que hay barreras que hemos tenido que superar, porque no todo es bueno, pero gracias a eso, a esos retos que se presentan al día a día, nosotras hemos ido creciendo, ¿no? Primero, una de las barreras a superar, que es el reconocimiento profesional del área de seguridad y salud en el trabajo. Antes la enfermería ocupacional no era reconocida como un campo diferenciado. Todas aquí en Perú, más o menos como decían, voy a trabajar mucho en la parte asistencial, que no está bien ni mal, pero hoy por hoy ya hay algo más, la parte de gestión, la parte preventiva, ¿no? Que nos encanta. Entonces, hoy gracias aquí en Perú a una ley que se tiene, que es la 29783, pues ha impulsado el tema académico, reconoce a las enfermeras como parte de un equipo clave de prevención y eso es súper bueno, ¿no? Punto número dos, la limitada formación académica especializada. Hace un par de años no había la especialidad en salud ocupacional. Se ha creado acá en Perú una especialidad para que nosotras nos podemos especializar, tener más conocimientos para poder pues ayudar a los trabajadores, para poder realizar nuestra parte preventiva, nuestra parte de gestión de muy buenas fuentes sobre todo, ¿no? Porque todo lo que nosotros hacemos es sustentado. Bien, entonces, en la parte número 3 de las barreras superadas está la invisibilidad del rol de la enfermera en una empresa, ¿no? Al inicio, las enfermeras ocupacionales eran vistos como apoyo clínico, como les comentaba hace un instante, ¿no? Pero hoy por hoy ocupamos cargos de coordinación, de gestión, lideramos programas de vigilancia en salud, lideramos programas de ergonomía, estamos certificadas también para involucrarnos en la parte de auditoría de la ISO 45001, ¿no? De seguridad y salud en el trabajo. Entonces, imagínense todo lo que hemos superado en estos años y que nos está sirviendo hoy por hoy a seguir creciendo más en la enfermería ocupacional, ¿no? Y el otro punto también que hemos superado, pero no al 100%, porque todo es un proceso, recordemos, es la dificultad para emprender y acceder a espacios de liderazgo, ¿no? Nosotros trabajamos siempre en la mano con un equipo multidisciplinario, los ingenieros, los médicos ocupacionales, ¿no? Entonces nosotros tenemos que trabajar siempre en equipo para repotenciar nuestros conocimientos. Bien, entonces dentro de la experiencia personal acá en Perú les comparto, ¿no? Yo creo que todos en un momento nos hemos situado en esa parte de iniciar, de buscar nuestro primer trabajo. No ha sido fácil, definitivamente no ha sido fácil en mi caso, ¿no? Yo creo que en varias de ustedes también. pero asimismo logré con mucho esfuerzo pues desarrollarme en sectores exigentes como minería, hidrocarburos y también en sectores del ámbito público, o sea, del Estado. Con el tiempo, pues tuve la oportunidad de compartir experiencias, de ir a congresos internacionales a compartir todo lo que hacemos acá en Perú, tanto en Colombia, tanto en México y en Honduras, ¿no? Y eso es bueno porque el compartir nos expande más como enfermeras ocupacionales. Y hoy por hoy, yo desde el tema de esa barrera que se me fue un poco complicada encontrar mi primer trabajo, que no encontraba una enfermera modelo para poder yo decir, yo quiero saber cómo sabe esta enfermera, quiero hacer seguridad y salud en el trabajo como lo hace esta enfermera. Hoy por hoy he tomado la decisión a partir del 2024 que nosotras tenemos que ser ese modelo para las nuevas generaciones, ¿no? Entonces, a través de una empresa que he formado, que se llama SCT Soluciones Empresariales, he dado ese paso a poder capacitar, a poder entrenar a otras colegas y puedan, pues, repotenciar esos conocimientos y acceder al campo laboral mucho más fácil. Pero, ¿quién te da la oportunidad si tú recién terminas la universidad? Difícil, ¿no? Difícil conseguir ello. Entonces, también se ha tomado en cuenta y se ha realizado la primera pasantía internacional para enfermeras en salud ocupacional completamente gratuita. ¿Qué quiero decir con ello? Que a partir de la empresa SCT Soluciones Empresariales hemos lanzado este programa que capacita, entrena y también al finalizar les da un certificado donde indican que nuestras colegas han realizado, han aprobado y han sido entrenadas como una pasantía internacional, como si hubieran trabajado para la empresa, ¿no? Entonces, yo creo que esto ha sido un paso súper importante porque estamos ayudando y nos estamos expandiendo y creo que esa es la idea, ¿no? Seguir entrenando, capacitando, compartir conocimientos sobre todo y experiencias. Ahora, mirando hacia el futuro, pues ya creo que no estamos tan lejos, ¿no? Con esto de la inteligencia artificial, el uso de la tecnología en seguridad en el trabajo, el uso de las aplicaciones, ¿no? La tendencia va a estar que las enfermeras vamos a ir analizando estos datos en tiempo real para prevenir accidentes, enfermedades ocupacionales, además también para liderar programas de vigilancia epidemiológica. Hay que saber aprovechar la tecnología a nuestro favor. ¿Y para qué? Para poder ayudar a más trabajadores. Bien, asimismo, a un futuro, la tendencia está en que nosotros también podamos participar en las políticas, en estándares de seguridad y salud en el trabajo. ¿Qué es lo que necesita la enfermera para seguir ayudando a más trabajadores, para seguir ayudando a más empresas? ¿No? La tendencia va a ser homologar, vamos a comenzar de aquí a un tiempo a homologar, a tener un criterio estándar para que todas manejemos la misma información y poder estar alineadas, ¿no? Y también adicional, participar en estas políticas que nos van a ayudar. Hacia el futuro, ¿qué más lo que se viene? Es la investigación en salud ocupacional, ¿no? Como enfermeras tenemos que demostrar que tenemos la parte científica, la parte de seguir investigando. Más conocimiento adquirimos, vamos a poder tener más opciones laborales. Bien, entonces la tendencia va a ser la creación de centros de investigación en salud ocupacional. Imagínate, ¿no? Imagínate, a través de la ICOH lo podemos realizar, pero no solamente hay que centrarnos ahí, sino hay que compartir, hay que poder tener una mira un poco más amplia para poder hacernos mucho más conocidas y ampliar nuestro campo laboral como se requiere, no solo a nivel Perú, a nivel internacional, como yo estoy segura que muchas de nuestras colegas que están presentes lo están realizando, ¿no? Entonces, hoy nosotros celebramos lo recorrido, vamos a reconocer los retos vencidos y nos proyectamos con mucha esperanza hacia lo que viene, porque las enfermeras ocupacionales no solo cuidamos la salud, también protegemos sueños, familias y futuros. Muchas gracias con todos, eso ha sido por parte de nosotros aquí en ICOH Perú.
Muchas gracias, licenciada Carmen, por dar inicio justamente a este webinar conmemorando la importancia y el rol que han tenido las enfermeras ocupacionales para todo el equipo multidisciplinario de SCT en Perú y en otras regiones, ¿no? Thank you so much. Miss Carmen, for sharing all these very important appointments and accomplishments that got from the occupational health nurses, not only in Peru, but also in Latin America and in other regions. Estamos a punto de ya empezar el webinar. Hay una encuesta que nos ha facilitado Miss Angie. So, Miss Angie, I have got the link with the survey that you just shared to me. And I would like to ask you if I may share the link by the chat, or should I download the document and share it by the chat?
I think let's, Dr. Devel, try and share it on the chat just with the link and let's see what happens.
Okay.
Okay.
So for everybody, I am sharing the link in the chat. So you can fulfill with all the information that is required. It's a survey elaborated by the Scientific Committee of Occupational Health Nursing. So please, you may click in the link that I just shared in the chat. Pueden dar clic en el link que he copiado en el chat, por favor. Es una encuesta o cuestionario elaborada por el Comité de Enfermería Ocupacional.
Just want to
So, Miss Angie, we
see.
are going to give some minutes to fulfill the survey.
I think Dr. Naval, sorry, it's coming through on sort of like a group share rather than the survey.
Oh,
When I looked earlier to see if I could share it with you again, it's not picking up your email. I just want to see if I can share with you. Um, I think, Dr. Novell, because of time, let's omit doing this. It's a little pop quiz. So
okay.
it was just to make sure that everybody was awake, because some of us are
Oh,
9 o'clock at night in our country.
okay.
So, and it was just a fun little quiz to see if we
Oh,
understood what the role of the OHN is globally and nationally. So um, what I can do, perhaps after our webinar, I'll
okay.
just liaise with Dr. Naval and see if we can share it afterwards.
Okay, thank you.
Also, because it's in Zoom, you need to have a Zoom thing. So you know, you need to sign into your Zoom account and stuff. So it's not actually working.
Yeah, and
It would be better on a Google Doc or so.
yeah, no, I agree. Yeah, it was just earlier on. I couldn't
Mm.
get Dr. Naval's the share thing to go in with his Zoom
Oh,
platform. So
okay.
yeah,
Yeah.
but don't worry.
Okay.
It was just
Okay.
a fun little
Necesita,
activity.
Miss Angie,
Okay.
sí, necesita permiso para entrar al link.
Sí,
Mm.
exactamente. Well, vamos a proseguir con el webinar. We're going to move along. Thank you, Miss Angie. Thank you, Miss Carmen. It is my pleasure to introduce you to Miss Oneisty Arco Canoles. Let me share with you this short presentation. Okay. So, Miss Onais del Carmen Dialgo Canolis is an associate professor and researcher of health and safety at work at Universidad Nacional de Colombia. She's a nurse epidemiologist. She has a master's degree in safety and health at work. She's the leader of the group of research on health and work. She's part of the research team of Ciencias. She's the national coordinator of the Red of Occupational Health Nurses in Colombia. She's author and editor of many chapters of different books, academic books, and research articles. So welcome, Ms. Onais. It's a pleasure to have you here. I will start
Thanks,
sharing. I will start.
Doc Norville, for the invitation. Haré la presentación en español. But good morning, good afternoon, and good evening for everyone. It's my pleasure to be in this moment with de Dr. Angie, de Dr. Penny, de Dr. Aira, and la licenciada Carmen, que nos ha compartido una apertura interesante de este espacio. Gracias, doctor Norby, realmente por la invitación. Es un placer poder conversar de uno de los temas que me apasiona y que he venido trabajando en Colombia en relación con la enfermería ocupacional en nuestro contexto. Y para eso me permití generar una pregunta que provocara. ¿Y si el cuidado fuera un derecho laboral? Y ahí quiero compartir algunas reflexiones que la enfermería ocupacional puede enseñarle a Latinoamérica, reconociendo esa labor que tenemos nosotros y nosotras como profesionales de enfermería, que cuidamos, pero que a veces adolecemos de quien nos cuide a nosotros como trabajadores de la salud. Y para ello, quiero, ¿qué pasó? Quiero por un momento que cierren los ojos y escuchen un relato que puede pasarnos en cualquiera de nuestras cotidianidades. ¿Sí? Yo siempre cuido, yo cuido, siempre he cuidado desde que tengo memoria. Ser enfermera ha sido mi forma de estar en el mundo. Trabajo en urgencias, donde todo arde, el tiempo, los cuerpos, las decisiones. Pero hace un año me quebré, literalmente. Una tendinitis en la muñeca derecha, un dolor que fue creciendo en silencio hasta que un día no pude canalizar una vena sin temblar. Ahí apareció ella, una enfermera también, una enfermera distinta, no con uniforme blanco ni estetoscopio, una enfermera observadora, audaz, atenta, llevaba una carpeta y mirada firme. Era una enfermera ocupacional. Me escuchó, me creyó, me preguntó por mis descansos, por mis pausas activas, mis turnos dobles, mi jornada extendida, mis cargas físicas y emocionales. Por primera vez alguien no quería saber solo si podía volver al trabajo, quería saber si yo estaba bien. Me explicó mis derechos, me acompañó en el proceso de incapacidad, en la rehabilitación, me ayudó a hablar con mi jefe, me enseñó que cuidarme también era parte del trabajo, que yo también merecía protección. Hoy estoy aquí volviendo a urgencias, pero ya no soy la misma. No solo cuido, también me cuido. Y cada vez que atiendo a otra enfermera, a una profesora con voz cansada, a un obrero con dolor lumbar, me acuerdo de ella, de esa enfermera ocupacional. Y pienso, ojalá todos los trabajadores tuvieran una enfermera ocupacional como la mía. Cuando el doctor Norville me invitó a participar de este espacio, pensaba cómo seguimos evidenciando lo que nosotros en enfermería hacemos para la salud y la seguridad en el trabajo. Y este relato es una de las diferentes situaciones que se presenta en el escenario del trabajo, al menos en Colombia. Haciendo una revisión internacional, encontré que las condiciones varían y ahora lo vamos a ver en diferentes escenarios. Y ahí la primera reflexión es cómo generar cuidados a quienes nos cuidan, cómo atendemos esa relación de simbiosis que se presenta entre las enfermeras ocupacionales, por ejemplo, y el personal sanitario. Y ahí encontramos un elemento que podríamos trabajar ampliamente, que es la salud y la seguridad en el trabajo, a partir de postulados, por ejemplo, como el que nos da la Organización Internacional del Trabajo, que nos invita a pensar en un trabajo decente. Y como este trabajo decente tiene unos elementos supremamente importantes, pero también de discusión, yo me permití agregarle trabajo digno, un trabajo que permita mostrar ese desarrollo que se tiene en los diferentes sectores económicos donde enfermería tiene un aporte importante que realizar a través del cuidado de la población. Y para ello, quiero que recordemos estos datos donde a la fecha de hoy la población mundial supera los 8.000 millones de habitantes, con una ligera mayoría de hombres, según el censo oficial de los Estados Unidos. Y la fuerza laboral mundial, fíjense que ronda un poquito menos de la mitad, pero que está muy cerca a la mitad, con 3,65 mil millones de personas. Y aquí hay una primera diferencia que a mí me gusta señalar, y es la proporción alta de hombres que existe frente a las mujeres, pero cuando hablamos de enfermería ocupacional, hablamos de una población mayoritariamente femenina, con una situación especial que estamos viviendo hoy, y es el aumento de la expectativa de vida de las personas, que nos invita a pensar entonces en cómo se está distribuyendo la población en América Latina y el Caribe. Y aquí vemos el comportamiento de la pirámide demográfica de 1960, la proyección de 2022 que acabamos de transitar, y cómo se espera ese movimiento para el 2060, donde nos tendríamos que preguntar entonces cuál va a ser el aporte fundamental de la enfermería y de la enfermería ocupacional para cuidar a esa población trabajadora, que además va a estar mediado por un componente de envejecimiento. Y no como un problema, sino como una realidad diferente que hace parte de nuestros desafíos en este momento histórico. Y junto con ello, las tasas de inactividad por edades para personas de más de 65 años en la proporción en el porcentaje, perdón, de la población en edad de trabajar. Y este mapa me gusta porque podemos ver gráficamente, visualmente, dónde se concentra esa población inactiva y esas edades, tal como se señala en este cuadrito que aparece aquí abajo. Y fíjense que el mapa cambia de acuerdo a los datos que se tienen para poder comprender un poco esta relación. Si bien vamos a hablar de América Latina y específicamente de Colombia, es importante evidenciar este benchmarking que se realizó para mirar dónde está trabajando hoy la gente con más de 65 años. Y fíjense que ya en el 2021 la OCDE nos dice que en Japón y en Corea ya no es tan inusual este comportamiento. Pero fíjense que aquí aparece ya Colombia y aparecen otros países latinoamericanos, como por ejemplo Chile, como por ejemplo México, que vendría en aumento, lo que nos invita a pensar entonces cómo hacer el abordaje de esta población. ¿Y quién haría ese abordaje? La población que se encarga de cuidar. Usualmente, ya aterrizándolo en América Latina, el 70% de los trabajadores está expuesto a riesgos de salud relacionados con el clima, un evento universal que es el tema del cambio climático que nos ha venido afectando. Y encontramos entonces 40% de la población que habita zonas rurales en países en desarrollo. Latinoamérica tiene varios de esos países, pero un número importante de millones de trabajadores que podrían sufrir algún tipo de cáncer, enfermedades cardiovasculares, disfunción renal, problemas de salud mental y otras lesiones físicas, según el informe de la OIT. Y fíjense que aquí toma gran valor lo que nos decía la licenciada Carmen hace un momento, y es cómo abordamos desde lo científico, desde lo técnico y desde la academia estas situaciones que ya se vienen presentando. ¿Por qué? Porque no estamos exentos de situaciones como el calor excesivo, la radiación solar ultravioleta, fenómenos meteorológicos que se han venido presentando, contaminación, enfermedades transmitidas por vectores y exposición agroquímica. Y esta imagen que ven aquí a su costado derecho nos invita también a reflexionar sobre, por un lado, la baja tasa de natalidad que se está presentando, pero por otro lado, cuando estas mujeres son trabajadoras y están expuestas a estas situaciones, pueden tener pérdidas de sus embriones. Entonces hay todos unos elementos para discutir que nos invitan a pensar en ese contexto general. Para ir aterrizando el escenario a enfermería ocupacional puntualmente, se estima que en el mundo, según la OMS, hay 29 millones de enfermeras y 2,2 millones de parteras alrededor del mundo. Sin embargo, aunque parece un número grande, aunque parece un número ambicioso, ya se estima la escasez de 4,5 millones de enfermeras para el año 2030. ¿Y a cuánto estamos del año 2030? A 5 años. Eso es un pestañear y nos encontramos de cara real a esa escasez que ya se empieza a presentar en algunas regiones, donde nosotros como América Latina no estamos exentos de esa realidad y que la compartimos con algunos países de África, del sudeste asiático y de la región mediterránea oriental. De esa forma, empezamos a encontrar aquí unos elementos que nos invitan a pensar cómo hacer de ese trabajo, de ese cuidado, un derecho laboral. Y es que en Latinoamérica especialmente entre el 48 y el 55% del empleo es informal, sin acceso a protección ni beneficios laborales. Países como México y Brasil se informa que por la OIT la informalidad alcanza el 52 y el 37% respectivamente. Países como Colombia tienen una tasa cerca del 55,8% según datos recientes del Departamento Administrativo Nacional de Estadística, que es quien consolida esta información oficial. Y de las enfermeras ocupacionales, por ejemplo, no tenemos un dato preciso de cuántas enfermeras existen en Colombia y de cuántas existen en la región. Si bien se estima que el número es creciente, hoy no podemos hacer esa contabilidad de ese número de profesionales específicos. Y frente a ello, para continuar con esta realidad regional, encontramos entonces el número de muertes, de lesiones, perdón, no mortales que calcula la OIT por año y el número de personas que mueren. Que si nosotros implementáramos desde los gobiernos, desde la academia, desde los espacios técnicos organizacionales, mejores estrategias, estos números seguramente podrían cambiar y podríamos darle paso a una realidad mejor para las y los trabajadores. Actualmente se dice que, nos dice la Organización Panamericana de la Salud, que hay 7,4 millones de profesionales de enfermería en las Américas, lo que representa el 63% de la fuerza laboral. Se estima que al menos en Colombia existe 1,3 profesionales por 1.000 habitantes. La OMS recomienda mínimo 3. Ya aquí podemos ver un primer desbalance porque estaríamos por debajo de la mitad de lo que se espera. Y si bien hay un estimado, pasa diferente con el tema de las enfermeras ocupacionales que sabemos que tienen un alto potencial, que tenemos un alto potencial para desarrollar estas actividades, pero que al desconocer el número, pues la motivación, la organización para que sigamos formando profesionales todavía requiere de mayor fortaleza. En Latinoamérica, el trabajo enferma y muchas veces mata en silencio, sumado por un lado a la condición de la informalidad a la que nos vemos expuestos, a la invisibilización a la que nos encontramos y Latinoamérica en varias ocasiones ha sido sistemáticamente postergada frente a situaciones que se presentan con elementos como la migración, donde sabemos que muchos de nuestros profesionales formados con altas cualificaciones migran buscando una mejor calidad de vida. Y eso nos sigue dejando en desbalance frente a la posibilidad de fortalecer el escenario regional y de fortalecer el escenario local por cada país, de seguir mejorando estos desarrollos que se pueden presentar. Sabemos nosotros por el ejercicio que hemos venido desarrollando y por la formación que tenemos que la enfermería ocupacional no es solo un tema de prevención, es un tema robusto, sí, pero está mediado también por ese compromiso que tenemos con la justicia social, con el activismo, con el cuidado de las y de los trabajadores y con el cuidado con conciencia crítica. ¿Por qué? Porque sabemos que dependiendo del sector en el que nos encontremos, dependiendo del grado de formación y de educación que tengan nuestros trabajadores, debemos implementar diferentes estrategias para dar alcance a las necesidades de esta población. Y quise traer un par de imágenes de realidades que se presentan no tanto en el escenario laboral, no tanto en el escenario ocupacional de quién cuida, perdón, de los cuidadores, que en este caso seríamos las enfermeras ocupacionales, sino de quién cuida, porque aquí se presenta una situación paralela. Tenemos unos trabajadores, enfermeras, enfermeros expertos que pueden brindar esos cuidados, pero que están agotados por ese número reducido que estábamos viendo que nos da la OMS y que nos da la OPS. Pasa en países como Brasil, pasa en países como Argentina, pasa en países como Colombia, donde se ha señalado de manera importante que la migración para nosotros es un efecto que nos invita a dialogar con las organizaciones gremiales, pero que también nos invita a dialogar con el gobierno y con gobiernos donde masivamente reclutan a nuestros profesionales, porque podría darse de manera mucho más amena y mucho más positiva esta migración. ¿Para qué? Para evitar que la población migre y pierda, o sea, gane de un lado unos derechos, pero nosotros como nación perdamos otros. Y aquí un poco el resumen de la doble exposición que les señalaba. Enfermeras que cuidan, pero ¿quién cuida a las enfermeras? Estas enfermeras que cuidan, entonces nos ha dicho el Consejo Internacional de Enfermeras que los escenarios hospitalarios son uno de los más peligrosos para realizar el trabajo. ¿Por qué? Porque se ven expuestos a peligros para su salud, donde se representa con lesiones y enfermedades laborales que incrementan la angustia psicológica y la insatisfacción laboral que provoca a menudo una alta rotación, lo que agrava de otra forma y exacerba los problemas de ese personal de enfermería. Pero ¿y quién cuida a las enfermeras? A esas enfermeras que se dedican al cuidado, ¿sí? Entonces aquí nos viene bien pensar en que debe ser personal experto y formado en el área, es decir, que hay que seguir trabajando en la formación en salud ocupacional, en salud y seguridad en el trabajo desde enfermería para poder realizar una valoración de condiciones de trabajo que desde la Universidad Nacional de Colombia nosotros tenemos un marco epistémico que nos invita a pensar en lo intralaboral, que es lo que se da dentro del lugar de trabajo, en lo extralaboral como unos elementos supremamente claves que pueden potenciar o que pueden ser un factor de riesgo para el trabajo y en las condiciones individuales. No es lo mismo tener 30 años que tener 60 años frente a una actividad, no es lo mismo tener unas condiciones de base, unas patologías de base que no por eso no puedo tener el trabajo, pero sí que deben cuidarse para que se garantice la mejor labor posible y trabajar con el Estado para políticas orientadas al bienestar y con asociaciones que promuevan la seguridad laboral. Y retomando un poco la pregunta entonces, ¿y si el cuidado fuera un derecho laboral? Aquí, cuando trabajaba esta pregunta, pensaba en varios momentos. Sí, lo primero es entonces que se reconozca que trabajar no solamente implica que yo tenga un salario y unas condiciones mínimas, sí, tienes un tiempito para descansar, sino que en ese cuidado como derecho laboral debería reconocerse que el cuidado es parte esencial de la dignidad del trabajador y que cuando ese trabajador está bien cuidado, va a haber un ejercicio de gana-gana. Gana el trabajador porque mantiene su salud, mantiene su bienestar, mantiene su motivación y también gana la organización porque la productividad no se ve afectada. Esto implica entonces que tengamos que pensar como sociedad, en la transformación de las relaciones laborales en vínculos más humanos, donde se reconozcan las necesidades y los desafíos a los que nos vemos enfrentados hoy, la salud física, la salud mental, la salud social, como componente central de la productividad y de la justicia social, que han sido preceptos y valores que han sido señalados en espacios internacionales para reconocer esa labor que realizan los enfermeros y las enfermeras ocupacionales. Algunos de los aportes que ha hecho la enfermería ocupacional a Latinoamérica ha sido esa visibilización del cuidado en el trabajo como un bien común. Y ahí encontramos, por ejemplo, en Colombia específicamente, a mujeres como Alicia Leal, que hace más de 30 años creyeron que era posible y se formaron con la OPS para brindar ese cuidado de enfermería orientado a las organizaciones, siguiendo un poco los pasos de Betty Molder, de Philippa Flowerday, ¿sí? Que han sido reconocidas como las mujeres pioneras de la enfermería ocupacional alrededor del mundo. Se articula el cuidado con la justicia social, porque reconocemos el tema de los determinantes sociales que son claves para el desarrollo de cualquier política. El aporte del enfoque integral entre vida y trabajo, la inspiración de políticas públicas transformadoras donde se reconozca al trabajador y a la trabajadora como seres humanos que requieren unos componentes básicos para vivir y para trabajar, y donde se dignifica la productividad del trabajador. Rápidamente, porque ya se nos está agotando el tiempo, desde la universidad hemos venido trabajando en la articulación de modelos educativos. Seguramente ustedes conocen el modelo de promoción de Nola Pender, ¿sí? Que apunta a esa promoción, valga la expresión. La Universidad Nacional de Colombia ha trabajado muy puntualmente en esta aproximación teórica del modelo de condiciones de trabajo de la Universidad Nacional, reconociendo el proceso de trabajo, las condiciones intralaborales que les señalaba un momento, condiciones extralaborales y condiciones individuales, y estamos trabajando en una aproximación para adaptar ese modelo de Nola Pender que nos habla abiertamente de la promoción al modelo de condiciones de trabajo donde podamos, desde la enfermería ocupacional y desde la formación interdisciplinar, hacer un aporte mayor, contundente a esa conducta promotora de la salud desde el escenario laboral, desde el momento uno. Este enfoque, por ejemplo, lo podemos encontrar, ahorita les comparto el enlace para que lo puedan criticar, para que lo puedan revisar y podamos hacer aportes, porque la construcción colectiva, por supuesto, siempre es más valiosa. Y lo hemos identificado como una prioridad política en el escenario del 2026-2030 que nos ha señalado la OMS para poder ampliar y distribuir equitativamente los puestos de trabajo en enfermería, especialmente en regiones marginadas, como lo señalábamos, fortalecer los sistemas educativos nacionales. Si bien en Colombia, por ejemplo, hace más de 40 años se hace formación interdisciplinaria, donde enfermería ha sido pionera, es necesario seguir ampliando esa oferta para que en cada lugar pequeño, mediano, grande de trabajo exista una enfermera que esté capacitada para apoyar el cuidado de la población trabajadora. Mejorar las condiciones de trabajo, seguir desarrollando la regulación de la enfermería, promover la equidad de género, no menos importante, el tema del aprovechamiento de las tecnologías digitales que hoy por hoy hacen parte de nuestra cotidianidad, y por supuesto promover el liderazgo de enfermería que garantiza que las oportunidades de desarrollo sean equitativas. Creo que esos son algunos elementos para compartir que teníamos para poder ambientar las reflexiones que nos señalaban. Y quiero compartirles aquí de manera adicional, con todo el cariño y con toda la modestia, un capítulo que trabajamos y que se acaba de lanzar en la Feria del Libro de este año, donde hablamos específicamente de la enfermería del trabajo, de ese pasado, presente y futuro, recopilando algún poco de la historia internacional que pueden conseguir en ese enlace. Y en este otro enlace encuentran el desarrollo del enfoque teórico que hemos venido trabajando, buscando que un aporte de la academia sea no solamente discutirlo, sino ofrecer más adelante este modelo de promoción de la salud en el lugar de trabajo como una apuesta que podamos socializar y que podamos implementar alrededor del mundo con el fin de reconocer que enfermería ocupacional tiene todo un escenario para seguir desarrollando y que podemos ser las líderes de la investigación en la academia, en la vigilancia, en el asesoramiento técnico a través de nuestro conocimiento, tanto a nivel estatal y gubernamental como a nivel académico y a nivel empresarial. Muchas gracias.
Muchas gracias, licenciado Neis. Ha sido un gusto escucharle y ver todo el avance, todo el aporte que han tenido desde Colombia para Latinoamérica y en realidad para todo el resto del mundo en cuanto a enfermería ocupacional, pero sobre todo por el aporte que han dado en cuanto a promoción de salud, como bien ha mencionado, en cuanto a investigación, pues sé que también trabaja mucho en investigación y toda la proyección que podemos tener a futuro. Por el tiempo, en aras del tiempo, vamos a dejar el espacio para las preguntas para el final. Estoy dando a admitir a varios de los asistentes que han quedado en la sala de espera. I'm still admitting the participants that has connected. They will be available to be part of this webinar too. So I just admit most of them. And it is right now. Oh, thank you so much, Miss Onais. It was such an honor to hear you, and it's very important that transcendent work that you have been doing, not only in your country, but also for Latin America. So we hope you can join us until the last part of the webinar, because we will have a space for the question and answers from the participants. So thank you, Ms. Onais. And now it's my pleasure to introduce you to the chair of the Scientific Committee of Occupational Health Nursing, who is Ms. Angie Butkowski, Angie Butkowski is a seasoned occupational health nurse practitioner of 24 years in occupational health in a variety of industries. She has been recognized as an accomplished leader, manager, advanced nurse specialist, and an innovative nurse educator in occupational health. She's highly competent and versatile in an array of blended teaching methods and advanced clinical skills with an expanding footprint across Africa. As a resourceful consultant, she consults on various occupational health safety governance documents and coordinates cost-effective interprofessional interventions in the prevention of occupational diseases and/or injuries, develops occupational health programs, and/or provides occupational and health and safety training and auditing services. Internationally, she has been an active ICOH member since 2015 and is member and the current chair of the Scientific Committee of Occupational Health Nursing, but also member from the Scientific Committee of Education and Training in Occupational Health and the Scientific Committee of Vibration and Noise Committee. So welcome, Ms. Angie. It's an honor to have you here with us.
Gracias, Dr. Novell. Thank you for inviting us. And I hope to share important information. I wanted to say I was trying to follow our first two colleagues. My Spanish is not very good. and Google Translate wasn't keeping up. So I do hope that I provide you with some new info. Um, Dr. Norval, if you can allow me to share, then I can.
Yes.
There we go. Thank you. Thank you. Content.
I just make you
Okay.
host so you can share your screen.
Thanks. Yeah, I'm just going to quickly get to. Sorry, I'm trying to get to my. Everything's open except what I need. There we go.
Mhm.
Okay. I can quickly just allow people in. I see there was some that okay. Are you able to see my PowerPoint?
Yes, we can see it.
Hi.
Yes.
Thank you. All right, and greetings to all. As you can see, I've used Google Translate quite a bit, and I just wanted to wish all the nurses, especially in Latin America, Peru, a happy Nurses Day for the 30th coming up. Let me see if this will move forward now. There we go. So I've been tasked to address the competencies required by the advanced nurse specialist as OC Health nurse practitioners, while my two colleagues to follow, uh, Kim Davis and Dr. Penny Orton, will address the roles and then another global solution to advancing the nurse specialist. So, not to spend too much time on, where we all fit in. I think we know that the cog takes many cog wheels to turn, and it's reliant on the employer, the employee, managers and supervisors, and of course the health team. My colleague was, Prof. Anais was, from what I could pick up, emphasizing how occupational health is often invisible. And we're part of that bigger cogwheel in the Health and Safety Committee. So, what is the occupational health practitioner? There's lots of definitions, and I've tried to summarize from a number of sources down to it referring to both the occupational health medical practitioner and the occupational nurse practitioner who have registered their additional professional postgraduate specialist qualifications in occupational health care with their mandated councils. And this is from across the world. Like I mentioned, there is an expanded view from ICOH and the WHO on the definition of our roles and so on, and that's where my colleagues will elaborate on. It's important to share who and how we defined OC Health practitioners because it's a fundamental principle in providing occupational health services. Especially in our developing countries, we still get quite a high incidence, if I can say, of employers using the local GP and a general registered nurse because they either don't know or have decided to, unfortunately, go a cheaper route. However, ICOH has taken the drive through the ICOH Marrakesh Declaration in 2024. So every 3 years, ICOH has a huge congress, a world congress, and where the executives of ICOH get together and look at what our goals are for the next 3 years. And for the current term, it's about enhancing occupational health research and practice by closing the gaps. And in particular, I just want to highlight item number 4 on the declaration and item number 6. The ultimate goal is to, for the current period, is to start beginning to provide universal coverage of occupational health services. And it's best done by a stepwise approach where you develop occupational health services for all by starting with basic occupational services and moving on towards comprehensive ones. And that's where we're still concerned that employers might feel that basic occupational health services means you can just use the local GP or registered nurse. And so today we going to highlight why it's so important to be using your occupational health practitioner. Part of the declaration is also, in order to achieve this universal occupational health care, we need to look at ensuring that our various health professionals, whether they are physicians, nurses, psychologists, epidemiologists, hygienists, ergonomists, and physiotherapists and safety engineers, are provided with a competency-based education that is at a tertiary level. And this is particularly important in our low and median income countries. And I'm glad Prof. Odyssey also highlighted that you've already begun postgraduate qualifications. That brings us to the next step of, and what are these professionals going to provide? Are they providing a clinical occupational health program or a wellness program or a general health program? I was very lucky to be part of a review on the textbook that you see on your screen with Susan Hatton, and my fellow colleagues with me today are also review some of the chapters. And this is where one of the focuses came out because it's a trend in Africa, especially South Africa, Europe, a little bit into Australia, that wellness is taking a focus instead of occupational health. And do we understand what the difference is? Because that determines the competencies of our OC health practitioners. For instance, and I've just taken a few snippets quickly. What is the purpose of your program? Do we understand that occupational health surveillance program is a team effort, and that the contemporary concept is to move away from the word medical surveillance towards occupational health surveillance? Because of these objectives, are we there to detect, prevent early diseases? Yes, you can do that with an occupational program as well as a wellness program. However, if you're there to detect and prevent early occupational diseases, then you need your occupational health practitioners. It's beyond your general nurse and so on, because of the undergrad training that they get. They do not have the insight yet to assist with detecting that purpose. That's just another one would be, if your program is there to promote activities regarding key aspects of the hierarchical control measures, then you need an OC health program, not a wellness program. When it comes to the needs assessment, your wellness practitioners, which are often general GPs, registered nurses, physios, a psychologist providing EAPs and so on, might not be occupationally or have the occupational insight. So when it comes to a needs assessment, we've got to look at, can that person do a situational and organizational analysis? Can that practitioner, and I'm talking the occ health practitioner, do a hazard identification risk assessment. And that is one of the competencies required in the occupational health service. Okay. So I encourage everyone to have a look. It's quite a comprehensive table of comparisons in chapter 8 of this book to give you an idea, who should I employ when I decide I'm going to start an occupational health surveillance program. Another solution that's been discussed at our various chair meetings is starting with a global recognized core curriculum for all OHPs, hygienists, safety professionals, ergonomists, industrial psychologists, industrial audiologists, and so many other health-related, occupational health and safety-related professionals. The discussions are still whether it should be 6 months or a year, but round about 6 months, equivalent of a postgraduate level 7. And keep in mind, I'm coming in from although I'm based in Mauritius, I'm coming in from South African influence, and that's the SAQA equivalent. And once they've done this core curriculum, they then move on to their specific groups at a higher level of NCERF level 8 that has specific requirements of their own country and done through accredited universities. The recommended approach would be, or the educational approach would be COIL by your ICOH experts. And Dr. Penny Orton is going to tell you more about that. So, due to our limited time together tonight, or this afternoon, let's focus on what would apply for the OC health nurse in this core curriculum and for all of us. Okay, it would be making sure we've covered at least an introduction to the medical legal framework, and then obviously afterwards you'd go into your various groups and focus on your specific country. Introduction to business and administration principles, followed by some case studies where you apply it in your sector. So are you in the mining industry, the food industry, the agricultural industry, and so on. And under that principles is important to cover clarifying what our roles are and these concepts. And I've just mentioned one of them. For instance, are we still referring to one of our biggest tasks, which is surveillance, as medical surveillance, or have we started using the word occupational health surveillance? And who does what in that program? Still on the business side, distinguishing HIRA, so hazard identification risk assessment, from health risk assessment, from just risk assessment. There's a lot of those concepts floating around. And the hygienist, for instance, might be able to do a very simplified health risk assessment, but in reality, that is the role of the occupational health practitioners to put those together. Okay, and a risk assessment could be anything from financial risk to, safety risk. Okay, and how are we implementing these concepts in our policies? Still part of that business administrative principles is introducing the team to how to develop OREPs, expecting the group of professionals who have done this core curriculum to be able to conduct a HIRA and an incident investigation and be able to report or help the employer report injury and diseases to the respective authorities. Under the occupational health science niches, the recommendation has been, like I said, to distinguish between the various surveillance programs, provide basic principles and procedures that apply to the occupational hygiene program so that we can understand how the hygienists work. understanding those basic principles of hierarchy of controls, and then introducing the participants to other scientific, occupational scientific topics like occupational exposure science, toxicology, and ergonomics. There needs to be a component on public health sciences in respect of epidemiology and environmental health. And there needs to be an introduction to social and behavioral sciences, because these are skills that the OHN needs as well. And that's an introduction to industrial psychology, introduction to industrial audiology, occupational therapy, and physio. Besides knowing what they do, these are our external consultants to our programs that we need to be able to refer to in order to case manage some of the cases. Oops, sorry, I went backwards instead of forward. So how do we build a global competency for OHNs? And what I've done is I've briefly just compared what is happening in America, the UK, Australia and New Zealand, South Africa, and Peru. And thank you, Prof. Ane, for highlighting some of the competencies required. I sort of picked it up in your presentation, because I struggled to find where the documents were. So yeah, across the world, it looks as if most organizations, whether they're professional associations or mandatory councils like the South African Nursing Council, require OC Health nursing practitioners to be trained at an NQF level 8. Most countries are insisting that there be a CPD, continued professional development after that. However, in South Africa, as much as they're working on it, this is 20 plus years now that they still haven't, implemented CPDs for the nurses. Okay, the doctors are expected to do it, but the nurses it's optional, which is a concern. I then took the nursing council competencies as listed, because that's were the ones, and I think Dr. Penny, you were involved with this, and with some of our colleagues at the time with the other universities, to highlight the domains that are there. Occupational health nursing practitioners are competent, and in South Africa from 2019 onwards, in legal and ethical practice. And what are those sub-tasks that need to happen is how well are they practicing within a scope of practice with the SHIC team? Are they, not just are they, how well are they displaying their collaborative skills? How well are they analyzing and interpreting legislation? Are they, and it's not just are they, it's not a yes, no answer, it's how well are they ensuring medical legal compliance for the health facilities that they are working in? How well are they designing and applying occupational health and safety policies? So you will notice there's a tick across all of them except Peru, because I couldn't see on the documents, there weren't any documents available, and those that were there, unfortunately, were in Spanish. So I'm hoping that my colleagues have touched on this, that these are competencies we expect of an advanced nurse practitioner. It's not just accept a policy. You need to be part of designing it and applying it. You need to have those advocacy skills to apply the WHO, IOL, and ICOH policies and guidelines. That's just a few from the domain of legal and ethical. Then there are quite a bit from the clinical side of it, from coordinating and conducting the HIRA and the HRAs. It's not just the hygienist who does a HIRA. To co-design and coordinate. So it's not just the doctor or the occupational health medical practitioner who's developing the surveillance program. We teach our health nurses in South Africa that they have to design it. and coordinate it and obviously implement and evaluate eventually. Okay. Designing health promotion programs is a competency required of the OHN. An example would be the hearing conservation program. It's often fragmented, and when you look around, everybody's thinking somebody else is doing it. It's actually a co-design by the OC Health medical practitioner and the OC Health nursing practitioner. And so quite a few more over here under the clinical one. And you'll see that I've indicated that in the UK, as endorsed by the Finnish Occupational Health Society and the Institute of Occupational Safety and Health, that there's about 3/4 of this clinical practice that they feel their OHNs should be competent on. Okay, so there's an article that I encourage you to read, because I think this is where the fragmentation starts coming in, is each country obviously decides what their competencies are, but have we actually sat down together and looked to see on a global platform what should we be able to do versus what we are actually doing? So a lot of the countries are expecting, for instance, the OHN to be able to declare certain categories of workers fit and generate that certificate of fitness. If you look at the mines in South Africa, only the OC Health doctor may do that in the mining, but in the corporate environment, the OHN can do most of them, except for some of the high risk or abnormal health outcomes. Okay. Case managing is one of our competencies from the clinical side. Being able to apply and do emergency preparedness versus emergency care. Those are two different skills and competencies. We must be able to consult and counsel. So consult is sitting around the table with other members of the team and counseling workers and the employer on how to handle outcomes from anything of public health trends that are happening to a trend that workers have suddenly started with pink eye in a department, in a specific area of the company and so on. We need to be able to have the competency to do ongoing evaluation of those epidemiology trends, toxology reports, HIRA reports, so that we can adopt our programs, both our group programs as well as our individual health plans. Okay. Then we are expected to have competency in management and leadership skills. How many of our clinic or colleagues in our clinical facilities are acting or serving as mentors? We struggle in South Africa to get mentors. To what extent is the OC Health nurse developing, planning, implementing, and evaluating and participating in those governance documents? And I think Peru, you guys are feeling the same struggle, okay? It's an expected competency, but yet in South Africa, you hardly see the OHN sitting around the table, okay? And so quite a few more, I'm just looking at my time. We've got to have the competency to utilize, for instance, utilize principles of human resource, finances, and the quality improvement program to manage our health facilities at both an operational management level and a strategic management level. So we're not just case managers. We've got to be or have the competency to manage a full-on facility, if not regionally, in other words, a whole number of facilities, and or be sitting at a strategic management level. We've got to have the competency to conduct our own internal audits, let alone be prepared with audits external like ISO and some of the the other audits that come up. Be able to, under research, that's another big competency area. How well, and this all comes in with that NQF level training. This is what SANC, the South African side anyway, has required all universities who are accredited to present the curriculum. We expect those graduates at an NQF level 8 to be able to conduct and participate in research as influenced by higher trends, the health risk assessment trends, and epidemiology trends. We expect them to apply the process of change when the epidemiology results come, change our surveillance programs or our services. We expect that graduate to be able to critically review research and not just accept the local chat on the WhatsApp group, for instance. And that, ladies and gentlemen, is a very quick overview of the competencies. Gracias, muchas gracias. I'm going to hand over to my colleagues now, Kim Davis and Dr. Penny, to elaborate a little bit more on the roles and then some solutions. Thank you so much.
Thank you so much, Miss Angie, for such a great presentation, especially reviewing the main aspects for the competencies that occupational health nurses should be training for, should be educated for, and should be hard in their daily job or being more focused on their daily job. I think that there are some very important topics that we as Latin America should take notes, especially those aspects when you mentioned about the work focus on emergency, if it's more on emergency preparedness or just giving the primary care when an emergency happens in a worker that suffer an injury inside the company, and also the role of the nurses inside the occupational health and safety management system when they have to interact, advise, and consult or give advisory and consulting service to the employer and the workers too. So thank you, Miss Angie. We will leave time for the question and answers at the end of the webinar. Okay, so I'm going to share the presentation to, let me introduce you to Miss Kim, our third speaker, who is also the secretary of the Scientific Committee of Occupational Health Nursing. Ms. Kim Davis is a seasoned occupational health nursing professional with over 3 decades of experience in leadership roles, including clinical practice, policy development, and education. As a military officer working within the South African National Defense Force, and an esteemed fellow of the Academy of Nurses Excellence in South Africa, she has co-authored safety management books and chaired international committees. As past president of the South African Society of Occupational Health Nursing, she champions interdisciplinary collaboration and evidence-based practice to advance workplace health. Her commitment to service, scholarship, and community engagement continues to shape the future of occupational health nursing in Africa. Welcome, Ms. Kim Davis. I will stop sharing and I will let you be the host. Oh, there's more participants trying to get in. I'm admitting them as soon as I can. But I think that you can share your screen, Miss Kim. Is it possible for you to share your screen? Oh, I think your microphone is off. Your microphone is turned off. Oh, no, it's not possible to hear you, Miss Kim. So now we see your presentation, Miss Kim, but please, you may try your microphone.
Dr. Navel, can I quickly call her on WhatsApp, and then maybe if you go ahead with Dr. Penny's one, then I can help Kim
Yes,
in
of
the
course.
background.
So we can go with Dr. Penny,
Okay.
right? Okay, so I'm going to share
Okay.
again to present Dr. Penny.
Turn around. The last couple holes.
Okay, so wow, Dr. Penny, let me check. Well, I've met Dr. Penny for a while. Actually, it's almost 10 years or even over 10 years. So it's a really pleasure to have you here, Penny. Uh, well, Dr. Penny is a nurse educator who holds a PhD from the University of KwaZulu-Natal, South Africa. Penny is currently pursuing many of her special interests, which spans education and research in academia and clinical occupational health practice. Penny has an appointment at Durban University of Technology as an honorary research fellow in the Faculty of Health Science, with responsibilities for postgraduate research supervision, mentoring, and coaching academics in the scholarship of teaching and learning and research supervision. Penny continues to consult in occupational health and does some clinical occupational health work, most recently related to a large chemical fire in Durban, South Africa. She has over 16 years of clinical occupational health experience, as well as 20 years of academic occupational health experience. Her experience has spanned many industries, including Nampak and South Africa breweries, and she worked for herself during a variety of enterprises. I met Dr. Penny back in 2014 at the summer school of Ludwig Maximilian University of Munich. And well, since then, I've been following her job, and it's incredible in education for occupational health nursing. So welcome, Dr. Penny.
Thank you, Norval. Nice to hook up again with you as well. So if I can share.
Please try, because I think you have the option to share your screen, your presentation. If not,
Yep.
just let me know.
And so you just go to slideshow, current slide. Well, thank you very much indeed for inviting me to be part of this important webinar tonight, or I think it's afternoon with you and evening with us. And yes, and congratulations to all the Peruvian nurses who will be celebrating their Nurses' Day in the next few days. So I wish you well with that, and I wish you well with your deliberations about nursing, and where we're going with nursing and the world of nursing and nursing in the world and all of those good things. I think there has been a recent publication from the International Commission on Nursing, and I know I have it on my list of things to do. State of the World's Nursing, it's called, and I keep meaning to go onto the website and download it just to have a read and see, where we are. But I think we're all healthcare professionals are critically in need, and it leads me really to my presentation, which is navigating interprofessional education for global practice with occupational health nurse practitioners. And this issue of an increasingly complex healthcare environment, both for individuals, families, and communities, and leads, makes the issue of interprofessional education very important. As occupational health nurses, we have this very complex worker safety, health, and well-being risks. And how do these things merge together and meld into quite a complex healthcare environment, which we work in as occupational health practitioners, and is very different to what most of us have experienced through our training. So interprofessional education and collaborative practice is an important concept in the response to this increasingly complex healthcare environment. And interprofessional education and collaborative practice promotes collaboration between various healthcare providers in delivering healthcare in challenging global environments where there are shortages of healthcare professionals and economic constraints. And I think the shortage of healthcare professionals across all the different disciplines is unbelievably enormous. I mean, they're banding around, sort of the numbers in the millions by 2030. And so we really do need to start thinking of innovative ways of multitasking, task shifting, all these different initiatives that are brought about. And one of those is through this whole interprofessional education. The collaborative practice enables the efficient and effective use of healthcare providers in improving patient care, and in our case, employee care. So post-COVID-19, the learning environment changed quite significantly. Obviously, the enormous injection into education was technology, and I see my colleague, Dr. Ivan Naranjan, is on the call, and so we were from Durban University of Technology. We had, prior to COVID-19, I think way back in 2010 already, I had put my occupational health specialist program into a blended learning delivery, where we had some online learning and then also some face-to-face in the blended way. But obviously with COVID-19, we had to pivot very quickly. And I know at the university that we were at, people had been quite reluctant, the lecturers, the academics had been quite reluctant largely to move to technology prior to COVID-19, despite our university really supporting us and giving us a lot of opportunities to get, into a blended mode. Or obviously we were a residential university, so we didn't have full-time or full-on online education. We had to have it blended, but very few of the academics took up the opportunities that were afforded. But boy, did they have to when COVID-19 came, and overnight we were all shut down and had to get into Teams and Zoom and everything else. But this post-COVID-19, it also enabled us to really get to grips with the technology, and I mean, now it's the whole AI issue, and how are we using AI in our education. I think of health professionals, no longer do you really need to carve up a cadaver. You don't need to encourage people to donate their bodies to science, because the technology is just so advanced that we can do all of that from at a computer or with a screen. And with that also came the importance, or highlighted the importance of the interprofessional education. And as well as this issue of lifelong continuing education and training. And interprofessional education allows for this to really, to take place and in innovative ways. So also Kashmiri and Mahapaba, sorry if I'm murdering his name, they've developed a competency framework of interprofessional occupational health in occupational health disciplines. And so we'll have a little look at that as well. Occupational health nursing focuses really on hazard prevention, health promotion, and worker rehabilitation. And then the interprofessional education builds skills in role clarity. So it's important for us, and we'll talk a little bit more about that, about really understanding what our roles are and who does what. The collaborative communication and the joint problem solving. So if we bring those two things together, the occupational health nursing and the IPE, it ensures that workplace health is addressed through coordinated multidisciplinary action. And the outcome then is a healthy, safe, and productive workforce. I just want to change my view because, yeah, that's better. Don't need to see myself. So what is interprofessional education? Really, the World Health Organization defines it as an experience that occurs when students from two or more professions, traditionally health professions, learn about, from, and with each other. Obviously, we need to think about what does that mean in occupational health, because in occupational health, it's a little bit different. We're often working with safety engineers, we're working with the ergonomists. I'd still consider the hygienists or health professionals, but sometimes it's environmental health officers. Some of them might, I think in South Africa, they are categorized and registered under our Health Professions Council. But we work with many different human resource practitioners and any number of different professionals. So in occupational health, I think interprofessional education and collaborative practice we need to think about who should we be having these exercises with, and how do we learn to communicate with these different professionals. So when we think about interprofessional education, there's 4 essential competencies. So we have to think about the values and ethics, and we've tried to build these competencies in students, the roles and responsibilities of the different disciplines within that team, the interprofessional communication, and how does that go about. And I would add to this the cultural communication as well. So what sort of intercultural competencies are we building in our interprofessional team? And then the whole issue of teamwork and team-based care. We look at interprofessional education's collaborative competencies. We need to think about from a community and population oriented, and in our case, that community and that population is the worker population, is the industries, the workplace is our community, and then the patient and family centered. And I think Angie spoke a little bit about how sometimes this occupational health is veering into wellness. And I think it is important with the increasing mental health issues that we see in the workplace. I think they say, fastest growing occupational disease, exacerbated very much so by COVID as well. And I think younger people coming in, we're seeing very much more mental health problems in younger people than I remember when I was growing up. So we really do need to start, perhaps spreading our wings, incorporating the family more into our care, which we don't tend to do in occupational health. We very much take care of the worker, but the worker comes from somewhere, he goes home to somewhere, and so we do need to often involve the family in their care. So the interprofessional teamwork and team-based practice, the interprofessional communication practices, we need to think about those and what do we develop and how do we go about developing these skills and these in our health graduates and particularly occupational health professionals. The roles and responsibilities for collaborative practice. And for that, it's very important that we really understand our own roles and responsibilities. And I know sometimes the edges get a bit blurred. And with the issues of task shifting, those, have also changed over years. And those of us who have been in the profession for a long time has seen how our own practices have changed. The roles and responsibilities of our own practices changed over the years as the pressure on the various health professionals increases, so things change. The values and ethics for intraprofessional practice. So why do we need to consider it? Really, the main thing is that it's been proven over and over again. Much research has been done, and it does really improve patient, or in our case, employee outcomes. It improves communication and collaboration of the health professions. It is effective in health promotion. It addresses healthcare needs of employees. It advances the health of populations, and in our case, worker health. So the entire sort of, worker population. It helps to develop collaborative practices amongst the different professions, and it changes attitudes towards other professions. I think there's often been, I don't know, Norval in Peru or in Latin America, but certainly in South Africa, there's often a little bit of a tussle between the nurses and the doctors. We find it probably less so in occupational health because we tend to work together. But as the South African Society of Occupational Health Nurses, we are being challenged by a certain sector of the occupational medicine practitioners. And sometimes, it gets our backs up, we get their backs up, and we kind of throw legal papers at them and legal opinions and whatever. So I think this working more together from at a student level and learning about the different roles and responsibilities, it would also help to change attitudes towards each other's profession, and also this understanding the roles and responsibilities of each other, and when to refer to who, for help. An example that doesn't really come from just in occupational health, but it's very seldom that the general practitioners, in South Africa anyway, are, they will very seldom refer one of their patients to the psychologist, for example. They rather just give them, some mental health medication that, oh, this antidepressant or anxiolytic will help you. And they don't often refer to the psychologist, for example. So it would help if, when the different health professionals work together, they learn about each other's competencies and roles and where they can leverage off the different expertise. There is evidence on the impact of interprofessional education for achieving what they're calling quintuple aim. And that evidence is rapidly evolving. And this quintuple aim means better patient care, better population health, better value for money, better work experience for the health professions, and a better health equity, giving everybody more access and a more positive experience and a better outcome in terms of health equity. The other thing that interprofessional education would help us to do is to build this cultural competence. So the integration of traditional indigenous healthcare practices with Western biomedicine. I think, in Latin America, there's probably a lot of traditional indigenous people who have traditional ways of health. And in South Africa, we very definitely have many different indigenous people and traditional ways of healthcare. And, I always say to people, irrespective of which community or cultural group you're from, we all have our own home remedies that we've been brought up with and beliefs. And so it's important to respect those. It's important that in multicultural societies that we learn about each other's traditional ways of doing things, that we respect those traditional ways, and we see ideas of how to integrate that into our healthcare practices. So building cultural competence is another construct that can be developed through interprofessional education. So the competency framework for occupational health team, which was developed by these two authors, I think from Iran, if I remember correctly. So they sort of identified 6 domains. 3 were specialist domains and then 3 general competencies. And under the specialist domains was prevention, so the sort of primary assessments, workplace exposure controls, the general health screening, the occupational health assessments, fitness for work assessments, occupational health examinations, and then occupational disease management, the diagnosis, treatment, and rehabilitation of work-related diseases. And then the general competencies, which dovetails very well with the interprofessional education competencies of interdisciplinary interprofessional collaboration, interorganizational collaboration and disciplinary teamwork, monitoring and supervision, education and evidence-based practice, so informed and evidence-based decision-making. And you can see the linkages into the competencies that Angie spoke about as well. So if we just take the research component that occupational health nurse practitioners in specialist nurse education in South Africa do, at a postgraduate diploma level, the research should be evidence-based practice, evidence-based research. They need to be not doing some primary research, learning about methodologies and so on. They should have done that at an undergraduate level. But at the postgraduate level, then they should be looking at evidence-based. So how do we translate evidence into practice? And that whole sort of systematic review, scoping review, that's the sort of research that should be being done at a postgraduate diploma level. So that as a clinician, as a practitioner, you're able to make these evidence-based decisions. And then training of the various stakeholders and professionalism, a commitment to the professional principles of each of our professions. And all of those general competencies, I think, dovetail very well with interprofessional education. So how can we do it? And this is probably more my area that I've spent quite many years working in, less so in the undergraduate education, but I think it's important, and many of the universities in South Africa do integrate interprofessional education into the undergraduate health professions. In fact, you can even do now at University of the Western Cape a master's in or a postgraduate diploma in interprofessional education. And they have a very strong team. Pretoria University also does very good interprofessional education with their health students. Even Sefako Mokgatlo University, many of the universities do good interprofessional education with their undergraduates. And then obviously into postgraduate specialist education. All specialist education in South Africa is now at a postgraduate diploma level, at an NQF level 8, and then you can obviously go on and do masters, but there's not a lot of coursework masters. Most of the masters are pure research masters, although there is a need for coursework masters in clinical areas. And then I think an area that we perhaps can get very much more involved in is in the continuous professional development and using some of the innovation in education to have, just like we are tonight, but, develop it a little bit more where we could have some breakout rooms and the different, put the interprofessional team together and go into breakout rooms with the different cases and so on. And into all the above, we can infuse virtual exchange. So I think at the moment we are engaging in some virtual exchange just because we are from different countries on a webinar. And this is an area that I've been working in since 2016. And the sort of type of virtual exchange, the virtual exchange is given many different names from global classrooms, collaborative online international learning, COIL, just plain virtual exchange. There's tons and tons of different names for it. And it's a very, very nice way. And I think you can easily, much of what we do in virtual exchange resonates in interprofessional education. So bringing these two things together is a fabulous way of educating, building intercultural competence, building teams and teamwork, communication, and technological skills. So really, when we think about what is COIL, it's a pedagogy that brings together students and teachers that are in geographically distant locations from very often different cultural backgrounds. The aim is to create team-taught learning environments where teachers from different cultures work together to develop a joint project that emphasizes experiential collaborative learning. So you give students work to do, they get on with it themselves, they collaborate and come up with, an answer to the problem or a project outcome. It gives new contextual meaning to content students explore. So, you can take occupational health nursing students with construction students, and maybe they need to build the construction students need to build a clinic in a factory, and the occupational health nursing students need to help them with the layout and what needs to go where and what do they need in that clinic. So two very diverse professions, but along the line you will collaborate. And so if you get students to do that, and develop, you will give them projects to do, and they have to develop the outcomes from that. They learn to collaborate with each other. They learn to work in teams. They learn about different cultures and how, because not only do we have different cultural backgrounds, but we also have different cultures within our professions. And that's something that students need to learn. So whether your student is us doing continual professional development or whether they're undergraduate students, it's important to learn the culture of different professions as well. COIL uses technology to bridge distance between students. So, we could easily do it with, just like we are tonight, although this is a pure webinar and not really a collaborative project. It's an inherently networked model of education, and the project cannot exist on a single campus or, country, or they require an actively engaged international partner. And this, I just felt Adam Zahn was a guy that we worked with a lot from Drexel University in the States, and this was how he described COIL. And I just felt each thing sort of brings it through. So how could we do it? An example of interprofessional education in occupational health using COIL. I think the easiest is to think of a case study, and we need to carefully construct this case study so that it enables or forces almost the collaboration between the different identified team members. So whether it's maybe we could have the hygienists and the medicine and nursing and ergonomists and safety engineers, for example. And we could put, carefully construct a case study that gave each one of those disciplines a part to play in solving the problem. You need to be able to go into breakout rooms. You need to structure some structured outputs so that the students, they have to work together and come up with, a solution. And we use the technology. The technology doesn't come before the problem, or we don't build our interaction or our interprofessional education task around the technology. The technology comes depending on what we want students to do. So just a couple of suggestions for case studies, and you might like to just think about some of these, and who do you think would be involved in this collaboration or this interprofessional education. If you were to take the healthcare workers in an operating theatre, which different disciplines would you bring in to collaborate on a particular problem that you could design through a case study to work together to solve the problem. So we need to think about how would we do it? Is it exactly like the case study? What sort of outcomes do we want students to develop or do? And then at the end, are they going to do a presentation? Are they going to develop a policy? Are they going to put an SOP in place? So how and when are they going to do it, and where are we going to do it? And what are we going to use? What sort of technology? When you look at COIL and doing virtual exchange, it's very important to be considerate of people's bandwidth, of the cost of data, and how easy that is, what sort of electricity. When we had COVID and we all pivoted to online learning, in South Africa, we were having load shedding. And everybody, the student body was all scattered around the province or sometimes the whole country. And the load shedding, which was electricity control, where they would switch the electricity off at different times, but it wasn't off at the same place at the same time. So the lecturer might be sitting in Durban and has got power, but the students, many students, wherever they are trying to hook in via the technology, don't have any electricity. So those are things we need to consider. I've done a lot of work with the students in Venezuela, and they also have huge issues around electricity. So those are some of the things we need to think about when we think about where and when and how we're going to do this virtual exchange. But I think it's an ideal way of infusing IPE into our continuing professional education. And for those who are on the webinar tonight, if they are in undergraduate or postgraduate formal education, it's a way that you can get some interprofessional education going. In fact, they call it, so I was not involved in the virtual interprofessional education. They call it VIPE, but there are some exercises they do. Not usually, it's a sort of once a year big, almost like a fair that they do virtually, where I know a lot of the African countries hook up together and they have a few days of doing virtual interprofessional education. So I think it has been done. It's being done across the world with many different countries and different health professions. And in our case, for occupational health, we need to think beyond just health professionals, but other safety and health professionals, as well as engineers. Sometimes it might be with the accountants or the lawyers, or, so there are many different people that make up the team by virtue of where we work, that we work in enterprises. So thank you very much. Here's a few references if anybody's interested, and yeah, I'm open to any questions at the end. Thank you.
Thank you so much, Benny, for such a great presentation and sharing of your experiences, especially because I know very close your job, not only as in the practice as nurse, but also in education and all the contribution you have done for that in your country and around the world. Uh, we are going to wait for the question and answers for the last part of our webinar. Please, Dr. Penny, if you can stay with us until the end, because we only have one more speaker. Miss, thank you, Penny. So, Miss Kim, um, I would like to ask you if you managed to solve the problem with your microphone, please.
I think so. Can you hear me now?
Yes, it's perfect. Thank you, Miss Kim,
Is
and
that
welcome.
better?
So we
Thank
are
you.
very glad
I
to
apo-
have you here as the Secretary of the Scientific Committee of Occupational Health Nursing. Welcome, Miss Kim.
Thank you very much as technology is supposed to be our friend, sometimes it is not quite. So my apologies for that.
No, never mind. Never mind.
Thank you. So I will look at the exploring the applied expanding role of the occupational health nurse practitioner in South Africa and in Africa. Occupational health is no longer just a peripheral concern. It is central to the workers' well-being, productivity, and equity. In Africa's diverse and undeserving workplace, occupational health are the stepping into the leadership roles, bridging care gaps, driving strategic health innovation, and challenges outdated care models. Today, we examine the evolving role, the challenges they face, and the bold steps required to advance workplace health. Occupational health is also essential to the primary caregiving, the disease prevention, and workers' well-being. We look at occupational health to bridge the gap where there's limited access to healthcare within industry and to drive the national universal healthcare, because South Africa is also looking towards that. Africa demands workplace where occupational health begins the implementation and the expanding of the role within occupational health. Supervise of the legacy role and the inflated safety or wellness misconception is something that we are looking at. These are some responsibilities have long been defined in occupational health nursing practitioner in South Africa. They focus on the prevention, early detection, and the rapid response to occupational hazards. These fundamental roles remain essential, but they've also paved the way for a broader, more strategic contribution by the occupational health nurse practitioner. If we look at the expanding role of the occupational health nursing practitioner in South Africa, we now lead the wellness, as Angie has mentioned, but it is not only the wellness programs. We are looking at it in a much broader sense. We also do the immunizations, manage workplace injury and diseases, which is a priority. We also do the support to the mental health program. And I think that that is critical in today's age, where we have got very many people that have got mental health issues. We monitor compliance to the Occupational Health and Safety Act, the COIDA, which is the Compensation of Occupational Injury and Disease, mining legislation, as well as serving on the front line in primary health care. In a lot of the companies or in industry within South Africa, that is the primary caregiver within a company. They also provide a holistic care, prevention of diseases, and are a direct content of medical care within the workplace setting. We also look at various other entities with regards to family planning, like Penny has mentioned. Family plays a very big role, as we know that a lot of people go back to their families, and that is something that we have to look at within the healthcare fraternity. If we look at the expanding role of occupational health nurses in Africa, as Penny and some of the other presenters has spoken about, task shifting due to the shortage of specialities. And I don't know about you in Peru, but if we look in South Africa, a lot of the nurses do not want to do nursing anymore. They want to branch out. So we are going to look at a huge nursing shortage within the next 15 years. And also a lot of the nurses are actually in a much more mature and advanced age. So we are looking at 50 and above. The workplace outbreak management, we looked at TB, HIV, and COVID was one of the diseases that we actually looked at. Across Africa, occupational health nurses stepping into an expanding role and bridging the gap. We left with specialized shortages through task shifting, as we've mentioned. This is also evident in the outbreak of COVID, where we advocated for vulnerable workers in the formal sector. They also build capacity by training the community health workers, strengthening grassroots system and resilience. As Penny has said, if we look at the education, it's not just in the industry, but actually a wider variety in the community as well. If we reflect on the application of these roles, the contemporary practice, we look at workplace wellness versus occupational health programs. And I think Angie also alluded to that. Who should have coordinated the COVID response in the workplace, and why did we leave it to other people? The ergonomic assessment and the prevention strategy is critical. Mental health support and stress management is something that we need to look at. The use of telehealth and remote consultations actually pivoted when we had COVID, as very many people in South Africa, and I think around the world, went and did remote consultation because the hospitals were full and everybody was very afraid to go to the hospitals. So contemporary practice demanding the shift, reactivating the occupational health to be proactive in wellness within the companies. COVID response shouldn't have just been a nurse-led, but agile and a trusted entity within the work environment. Economic strategies are something that we have to look at, the holistic care now, not only the workers, the employees, but also the community at large. Prevention and resilience in a diverse workplace is actually critical. Nurses are central to this evolving integrated health landscape within the continent as well as in the country. Despite these critical roles, occupational health nurses face significant setbacks during the pandemic. Public sector service also struggled with compliance due to the systematic gap. I think, and that was evident all over, PPE and a lot of medical assistance that we needed were not always just available. These challenges underscore the urgent need of policy reform, investment in training, as Penny had said, and a strong recognition of the occupational health nurses' strategic values, which lines up nicely with what Angie has said to us. If we look at the opportunities, policy, advocacy, and interprofessional education, I think that is something that we need to harness, especially with webinars like these, where we get to know about other countries and how we can take hands, collaborate, and look at education actually in the world and within the regions, also within occupational health specifically. Regional collaboration and look at best practices. The rising demand of industrialization and the informal labor market, where we have the small enterprises like people selling fruit along the side of the road, or the baker, and that is something that we definitely need to look at. We stand at a pivotal moment with the policy, advocacy, and interprofessional education. We need to shape a healthier workplace and a healthier workforce. Regional collaboration fosters shared learning and innovation, with industrial growth and the exception of the informal sector, as I said, demands more occupational health expertise, and we need to increase the pool. The opportunities required bold and strategic leadership amongst occupational health nursing professionals, and I think that this needs to be worldwide. In conclusion, occupational health nurses are the frontline advanced nursing practitioner who protects and promotes the workforce, not only in Africa, South Africa, but worldwide. We fully recognize the use of the expanding role and the pivot of the World Health Organization, especially with the universal health coverage in delivering healthcare to all. Recommendations which I think we need to look at. We need to strengthen the occupational health nursing curriculum to the NQF level 8, as Angie has alluded to, in the postgraduate level globally. And as we saw, it is not just in South Africa, it is all over, where we need to up the game of the professional societies. Incorporate the interprofessional education into the occupational health practitioners curriculum globally, and enforce the CPD, which is your continuous professional development program. And I think that this is a start of a good thing where we have intercollaboration with other occupational health nurses, and especially in Peru and in the country. And I think that that is what SCOAN is so good at, is looking at the collaboration. Each country nurses medical council to update and align the support, the global recognition, the expanding role, and the competency of the occupational health nurse practitioner in various governance, documents, policy, implementation. We need to take up the role and make sure that we are in government and that we have a say within legislation and the implementation of policies. Promote regional knowledge sharing. I think the empowering of the occupational health practitioner ensures a healthier workforce for all. And I thank you.
Thank you so much, Ms. Kim, for such a great presentation and sharing all your experience through South Africa and Africa, actually the overview inside Africa. And well, right now we are going to start a section of questions and answers. So please feel free to make questions in English or in Spanish, and we can help you with the translation, because I know that we have attendees from Latin America and attendees from USA and other countries. Los invitamos a todos a que puedan hacer preguntas, ya sea en español o en inglés, y les podemos ayudar también con la traducción, porque sabemos que hay participantes tanto de Latinoamérica, de Estados Unidos y de otras regiones. Están conectadas las 4 expositoras, también nuestro representante de Perú, así que son bienvenidos para poder hacer preguntas. Si me permiten, a mí me gustaría comenzar justamente con la primera expositora, Miss Oneis, licenciada Oneis. Me pareció muy interesante cómo nos exhortaba justamente a que se pueda iniciar la investigación en salud ocupacional teniendo a las enfermeras en el campo de promoción de la salud y en otros campos en los cuales usted ya ha ido incursionando. ¿Nos podría compartir recomendaciones cuando tenemos países de repente donde aún no hay enfermeras ocupacionales y quieren empezar de cero en cuanto a investigación en enfermería ocupacional?
Muchas gracias, Norville, por esta rica experiencia esta mañana. Yo creo que una forma de iniciar investigación donde aún no hay enfermeras ocupacionales es desde la enfermería misma. Nuestra razón de ser como enfermeras es cuidar, pero no cuidar solamente por un tema de vocación, sino por un tema que hemos venido documentando a través del tiempo y que hoy se respaldan con nuestras teorías y nuestros modelos. Creo que ese ejercicio que hemos venido haciendo, al menos aquí en Colombia, de intentar poner en diálogo el modelo de Nola Pender con el modelo epistémico de condiciones de trabajo es un buen ejercicio. Y otra consideración que creo que es supremamente importante es reconocer que la salud ocupacional o la salud y la seguridad en el trabajo no son temas que debemos trabajar de manera disciplinares, sino que debemos trabajar de manera interdisciplinaria, de manera que cada quien aporte a esa salud de los trabajadores. Creo que ahí habría dos elementos. Y por supuesto, si fuera posible y si tuviésemos esa incidencia en la política pública. Cuando el tema se convierte en un tema de política pública, hay más posibilidades de iniciar con la investigación donde se permea a la sociedad de manera general.
Muchas gracias, licenciado Neis. ¿Alguien de los participantes que quisiera aprovechar y me hacer alguna pregunta al licenciado Neis? So for our speakers in English, we just talk about how we can start from zero when we talk about research related to occupational health nursing, especially in countries from Latin America. So based on your experience in South Africa, which would you recommend us? And then we go with the question from Miss Ida Busco from Chile. So maybe Miss Angie or Dr. Penny would like to give us recommendations.
Thank you, Dr. Noel. Penny, do you mind if I go ahead?
No,
No, you go. I can add if there's anything else I think of.
Thank you. We have a similar, how do you say, challenge in South Africa and throughout Africa. And just on a quick review of the different nursing categories in Peru, I think you're also sitting with the challenge where nurses have basic nursing has been the training has been at like an NQF level 6 or 7, and now you're expecting them to perform at an NQF level 8. What we did during our transition, the Nursing Council, was allow, and it's not bridging. In other words, you would go and do a research, not a research, a level or a subject in research for a year. So very similar to what Dr. Penny was talking about. It's a master's by coursework. So you're actually covering 2 levels already. And by the time you're at the end of your 2 years, you've got your level up to at least a level 7. Okay. Then knowing the basics of research and so on. But we really looking at the nurse specialist being at a master's level. So, sorry, Benny, would you like to add?
Yeah, so in just tell me the question again. Sorry, Angie. What was the initial question?
Sorry, I think the question came from Prof. Anais was. Sorry,
Okay.
no.
It's when we start from zero in countries such as Latin America and we want to start a research project related to occupational health nursing, which recommendations could you give us? Maybe the field we should start in, or maybe how we can confirm our research team, which topics can we focus more on?
Okay.
Oh, I see. I misunderstood the question.
Yeah.
Okay.
Yeah.
Sorry.
Oh.
So
Okay.
I think the one thing is that if the nurses are being trained at a bachelor degree level for general nursing, or the sort of first entry, and then they will do research in that at that level. And I think that at that level, it's important. Obviously, they have to learn the research process, the different methodologies, et cetera, et cetera. Then when you get to the postgraduate level, there's, as I mentioned, it's better for the postgraduates to do the evidence-based practice where they learn how to translate evidence into practice. Then with their knowledge they've got of research, of the methodologies, etc., they're then able to interrogate in the journal articles, the quality of this research. Was the sample size good enough? Was the statistics suitable for the question that was being asked? Was the methodology appropriate, etc., etc.? And look for effect sizes or errors of measurement errors and so on that might creep in, and be able to interrogate the quality of the research and then translate that into actual practice or policy. However, I think there's an opportunity for us who maybe are not in any formal education, the Nursing Association or the SCOAN group, or just a special interest group of occupational medicine and occupational nursing, and maybe hygienists, whoever's interested, and bringing a more informal group together who want to conduct research on their own, because there's nothing to say, oh, I'm not formally employed in a university where research is a requirement, or I'm not in any sort of formal education. There's nothing to stop us getting together and conducting research, and doing it legitimately and ethically, applying to the university, to get ethics approval, and it's to use the team. So, for example, if I do independent research, because I'm an honorary research fellow at Durban University of Technology, I'm able to put the research proposal through the DUT Ethics Committee to get ethical approval. And there would be nothing to stop a special interest group of people. And I think in terms of topics to look at is really what do you find are the issues on the shop floor, so to speak? What are the problems that are being faced? Either if it's a purely nursing thing, what are the problems that the nurses are facing in their occupational health practice? Is it clinical? Is it education? Is it on policy or management issues? And then to develop a special interest group that works together. And because of technology, you can have an international group as well, that different people who have got different skills can bring to the table. And I belong to a group of an international network of nurses in HIV/AIDS research. So they're based in the US, and they've been going for 20 or 20, more than 20 years, I think now. And they've done, I think they're up to study 9. So every few years they have another study. And whoever wants to kind of join it, you just join and you put in the proposal through your university, but you pool in the data. So there's many different ways of doing it, and even enabling people. And there's nothing to stop us through SCOAN, for example, putting together a short course in research methodology for anybody who is interested in it. Obviously, there wouldn't be any accreditation or certification or anything like that, but just in terms of continuing professional development. So there are different ways of doing it, even outside of formal education. And I think topics, it's really what are burning topics? What are the problems that people are facing in their practice? And then we can, you can research those topics. Hope that helps.
Yeah. If I may add on topics, we currently, SCOAN is in a collaborative research with SCAP, which is one of the other scientific committees, SCOM and the neurotoxicology group, on a guideline a guideline in identifying and managing occupational health diseases, so that the rest of the team can help. That's, for example, a topic. Another topic that's come up is Scone has, back in 2013 was the last time we looked at the roles of the OHN, and those roles influence your job descriptions, the reality out there. So and I know the group with IOSH are actually working on that, and they've approached some of the SCOAN members to help them with that. So yes, yeah, please. There's no specific topics, but if there's something happening in your country, we'd definitely like to collaborate on and we're from about 14 different countries at the moment in the SCOAN membership.
Okay, thank you, Miss Angie. Thank you. Thank you, Miss Angie. Thank you, Dr. Penny. We have a question from Miss Ida Busco from Chile. If you want, you can turn on your microphone and please do make your question as you feel more comfortable in Spanish or in English.
Muchas gracias, Norby. Sí, mi English is a little bit. Y quizás ya se respondió la pregunta que voy a hacer, pero también para las panelistas quiero entender, en la opinión de ustedes, cuál es el rol de enfermería de salud ocupacional que no puede ser realizado por otro profesional del equipo de salud ocupacional. Porque nosotros tenemos aquí en Chile especialistas en salud ocupacional de distintas profesiones, no solo enfermeras. Hay kinesiólogos, psicólogos, profesores de educación física, ingenieros en prevención. Entonces, me gustaría entender hoy día cuál es la experiencia que tienen en aquel rol que es exclusivo y que puede aportar realmente a la salud de los trabajadores y es valorado por el trabajador y por el empleado. Es en realidad para Oneis, para Angie también, para Dr. Penny. La experiencia, ¿qué está pasando fuera de Chile en esa materia? Norvik, si me
Sí,
puedes
por
ayudar
favor.
con la traducción.
Sí, por favor, de repente comenzamos con las speakers en español. Miss Oneis.
Ok, Norville, muchas gracias, Ida, por esta pregunta que invita a pensar cuál es ese factor diferencial del profesional de enfermería, experto en salud ocupacional. Nosotros hemos hecho un par de revisiones y coincidimos con nuestras colegas de África, de Estados Unidos, donde la formación debe darse de manera muy fortalecida para que el profesional pueda destacar, porque de manera adicional el trabajo cada vez se hace de manera interdisciplinaria. Sin embargo, al menos acá en Colombia hemos podido identificar en varias experiencias que hemos trabajado que el tema de la educación en enfermería es clave para abordar diferentes escenarios. Como se señalaba al principio de la presentación, hoy encontramos más trabajadores expuestos, por ejemplo, a enfermedades cardiovasculares, pero están en su lugar de trabajo. Y ahí enfermería ha liderado banderas de la educación hace mucho tiempo. Y esa educación, esos programas que se han trabajado de intervención, tienen un impacto muy positivo en mejorar, en explicar, en que el trabajador comprenda por qué hay que hacer el proceso, por qué debe cambiar la rutina, cómo debe hacerlo. Y creo que esa es una de los grandes factores diferenciales. Pasa de manera similar con algunos sistemas de vigilancia epidemiológica. Sí, sabemos que hay sistemas de vigilancia epidemiológica para el tema psicosocial y ahí el experto sería el psicólogo, por ejemplo, pero también encontramos sistemas de vigilancia epidemiológica ocupacional donde enfermería tiene todo el desarrollo para hacer. y creo que no menos importante el tema de la actuación política, que quizá como enfermería misma hemos en muchas ocasiones dejado de lado, no hemos asumido el liderazgo que ahí corresponde para poder visibilizar lo que realizamos. Muchas veces enfermería no escribe, no documenta y se queda rezagado todas esas intervenciones que hacemos, todo ese impacto que se genera, y creo que con esos tres elementos podríamos darle un poco ambientación para la discusión: la educación, la actuación política y la vigilancia epidemiológica. Y no quisiera dejar de lado el asesoramiento técnico, porque, como lo señalaba en algún momento, nosotros estamos amparados en teorías. En la teoría, por ejemplo, de Dorotea Oren del autocuidado, donde tendríamos todo el bagaje para decir cómo trabajamos, cómo le ofrecemos herramientas al trabajador para que sea responsable de su cuidado. No la pender el tema de la promoción de la salud. Ahí tendríamos desde el acervo propio elementos amplios y suficientes para aportar, sí, con el asesoramiento científico y técnico, pero apostándole a la educación.
Muchas gracias. Muchas gracias.
Muchas gracias, licenciada Neis. Ah, licenciada Carmen Bernaola, no sé si también nos pudiera aportar con la pregunta para la licenciada Ida.
Sí, claro, no sé si logran escucharme.
Sí, sí.
Bien, sí, justamente en lo que hace mención, ¿no? Del rol de las enfermeras ocupacionales, aquí en Perú vemos una figura de un equipo multidisciplinario, ¿no? Casi en todas las empresas, instituciones, entidades, tanto del sector privado y público, se maneja siempre en su mayoría, ¿no? Encabezado por el ingeniero que ve temas de seguridad, de ahí el médico ocupacional también conjuntamente con la enfermera ocupacional. Y no todas las empresas aquí en Perú tienen el psicólogo ocupacional y a veces nosotras como enfermeras tenemos que asumir ese rol, ¿no? De poder dar soporte emocional a los trabajadores, cómo logras llegar a los trabajadores, que no se pase ese límite de la confianza con el respeto, cómo hacemos que ellos nos puedan contar sus cosas para que puedan trabajar y para que puedan producir mucho más, ¿no? Por otro lado, también dentro de los roles de enfermería, el Colegio de Enfermeros de Lima Metropolitana, pues ha sacado una resolución en la cual hace mención bastante al tema del rol, ¿no? Como seis actividades, seis funciones que tiene que realizar la enfermera ocupacional. Y eso es importante, ¿no? Porque prácticamente es como que nos va direccionando a qué es lo que nosotras tenemos que hacer. Entre los más destacados, actividades, funciones que nosotros realizamos, pues es el tema de atención de urgencias y emergencias, de ahí el tema de seguimiento de las enfermedades ocupacionales, ¿no? Asimismo, la vigilancia. Mis trabajadores pasan exámenes médicos conjuntamente con el médico ocupacional, vemos qué cosas podemos implementar para que ya no tener muchos trabajadores quizás con obesidad, ¿no? Entonces vemos bastante la parte de implementación, la parte de gestión sobre todo, ¿no? Y también el tema de los indicadores, y eso es muy importante porque también no nos deja la parte solamente asistencial, sino la parte de gestión, cómo nosotros podemos, con todas las actividades que realizamos, cómo vemos si hemos logrado metas o hemos superado las metas que nos ponemos en el año, ¿no? Y eso es comentándoles de una manera que el rol de enfermería en empresa, pero también nos vamos a la otra parte, aquella enfermera que está asumiendo cargos de coordinación en materia de seguridad y salud en el trabajo, ¿no? Su rol ya es diferente, más que todo de gestión, más que todo ver presupuesto, de qué requiero, cuánto dinero requiero para poder lograr que mi trabajador produzca más, que no se enferme y que todo siga bien, ¿no? Entonces, es ahí donde nosotros ampliamos más nuestro campo y nos dedicamos también a asesorar de repente a sindicatos, asesorar a trabajadores en problemas legales, en capacitar a empresas y también a trabajadores de diferentes rubros, ¿no? En materia de seguridad y salud en el trabajo. Entonces, casi todo se da de esta manera aquí en Perú, ¿no? Trabajamos siempre con un equipo multidisciplinario y por eso siempre no hay que olvidarnos del trabajo en equipo, ¿no? Eso sería todo.
Muchas gracias.
Gracias. Maybe for the speakers in English, I will translate the question from Miss Ida Busco. Even though occupational health and safety team it's multidisciplinary, where we have engineer, physicians, of course, nurses, and psychologists. What makes occupational health nurse role different from the rest of the specialists?
Kim, would you like to take that one?
Now you can go ahead, Angie.
Okay.
Mhm.
Thank you so much for the question, Ida. Um, we are focused on, for instance, on the clinical side. Your an example would be the safety professional should not have been the one putting together a questionnaire for COVID. That should have come from the occupational health nurse. That would be a simple health risk survey. When you've got the health promotion programs like reducing alcohol, substance abuse in general, you want the OC health nurse coordinating that, not the safety professional. You still need them as part of the team, but the lead should be the OC health nurse. Another example would be rehabilitation, about getting the worker back to work and with reasonable accommodation and or vocational rehab. So we're the ones that should be the ones coordinating the occupational therapist and the psychologist and all the other team members to get that person back to work as soon as possible, hopefully in the same role, but if not, in another role that they can still be productive at work. So our role, what makes us different to the others is predominantly our clinical role, but we've also got for instance, when it comes to your management and leadership role, an example would be there are different models and I'm sure this happens in Peru as well. You've got walk-in clinics, you've got an on-site clinic, you've got a practitioner deciding they're going to start their own business, a mobile. Your OC health practitioners, so it's a dual responsibility between the medical practitioner and the nurse with those specialities, need to be running those organizations. And in South Africa, we currently faced with non-medical people trying to open up businesses and things, as an example, because they've been given an introduction to health. In other words, and I want to use an example of a paramedic that went on a audio course, an audiometry course. That doesn't make him an expert. He is purely a registered audiometrist. But yet you've got paramedics trying to open a occupational health service because he did 3 of the skills as an assistant in a clinic. So yeah, just to give you an example, we should be leading. That's what makes the difference. Leading on the health side of things. Yeah.
I think that I understand a little bit. Help, please, Norville.
Okay.
Hay práctica clínica, o sea, se enfocan en la práctica clínica, lo que entiendo,
Sí,
en el ámbito de Sudáfrica, también en promoción de la salud.
exacto.
Ya.
Práctica clínica,
Y
promoción de salud a través de la educación, a través de la
educación, sí,
formación. Ajá.
efectivamente, y no entendí el tema médico.
Ah, no,
No hay
en
médico.
realidad sí han mencionado que sí hay soporte médico,
Ah, ya.
pero que no lo puede asumir el ingeniero de seguridad. O sea, el
Ah,
safety
obvio. Ya.
specialist, lo que suele pasar a veces, ¿no? Y hemos visto acá en Perú, a veces es el ingeniero de seguridad quien tiende a asumir un poco los temas de salud,
Sí,
que
no
no
puedo
es una
responder.
buena práctica, ¿no? Hay
Sí, no,
mucho
no
sesgo en
podemos.
eso y por supuesto muchos temas de ética que no están
Sí,
adecuadas.
que no corresponde. Y ahí es donde la enfermera tiene un rol, obviamente.
Exactamente. Por ejemplo, acá en
Perfecto.
Perú yo lo he visto mucho en el sector construcción y en agricultura, donde no siempre hay la presencia de un médico ni a tiempo completo y a veces tampoco ni siquiera a tiempo parcial, pero es la enfermera quien da ese soporte en los temas de salud ocupacional, quien puede tener acceso a
Sí,
los expedientes médicos, quien puede tener esa atención con el trabajador para, como decía la licenciada Carmen, llegar al trabajador y manejar con confidencialidad toda la información
sí, sí,
de
tal
salud,
cual.
¿no?
Perfecto. Muchas
En
gracias.
otros,
Muchas gracias,
Well,
Angie.
oh, sí,
I also think that the nurses are distinguished between the other practitioners and expertise because they are more human-centered, which sets them apart from the other health professionals within the occupational health setting because they are so much more involved with the clients or the employees. They look at the healthcare not only within the working area, but also in the management. There's a lot of stewardship and advocacy for ethical upholding of the healthcare providers, not only within the industry, but also in the health environment and the complexity that it brings within the communities. So I think that that is also one of the things that the occupational health nurse practitioner is more in tuned with than the hygienist, for example, or the medical officer, because in South Africa, the medical officer is sometimes only at a clinic 1 hour in a week, where the nursing officer is there the entire time.
yes, and I think that probably you there in South Africa have been working a lot of primary care, right? As nurses,
Yes.
and of course clinical practice also, and maybe we can get some of those perspectives to bring it to Peru and Latin America, because it's very similar. I think that occupational health nurses here are very, as you mentioned, human, very kind. They develop empathy and a good relation between patient and nurse, and that builds a trusting relationship, so the worker can not only mention the problems or symptoms that they are dealing with, but also they can, trust that this occupational health specialist, the nurse, will work and try to improve his or her working conditions and wellness, right?
Yes. So I do think it also tallies up very nice with your mental health, your lifestyle, to tailor it to the workforce where the occupational health nurse practitioner actually works and resides in. So I think that that in a nutshell definitely does tie it up very nicely.
Great. I always remember, for example, as I told you, I was in the summer school with Dr. Penny, where we were teaching interventions inside companies. And I think that through education, inside companies, inside universities, we can also, I mean, you as occupational health nurses and we as occupational medicine physicians can develop a strategy to create, and to sustain this prevention culture inside the company. I mean, besides the clinical practice, which is useful and needed, education programs are also very crucial for the occupational health and safety system. And I think that's another area or field where you as nurses can play an important role, right?
Correct, yes.
Yes, I do agree.
Yes. Well, thank you all of you. Uh, is there any other one participant that would like to make a question? Ya sea en inglés o en español, y podemos ayudarles con la participación.
I think that there was one in the chat. They were wanting to know if there are mentorship programs affiliated to university where the students are studying in Peru. Also, do you have any facilities accredited required for industries or facilities to support students within their nurse or in their practiced learning from the chat, Novelle?
Oh, thank you, Miss Kim. Well, for physicians, actually, mentorship in occupational safety and health, there is no for undergraduate students. There are postgraduate courses such as master programs or the residency program where there is kind of mentorship, but not necessary so well built as a mentorship. It's more like, professor and student, but um, you work hard, you study, you receive classes, but mentorship as, someone who can be with you, someone that can be dealing with you the problems or guide or as a guidance or give you advisory, continuous advisory. Probably we are still in the process to build that mentorship. Okay, but it's only for postgraduate um, specialists. For undergraduate, when you're still studying for being graduate as a physician or as a nurse, I have not found that there are mentorship in occupational health. No sé si, licenciada Carmen en Perú y licenciada Oneis en Colombia, hay programas de mentoría en salud ocupacional en las universidades o en las empresas para enfermeras ocupacionales.
Sí, ¿qué tal, doctor Norby? A ver, en esa pregunta sí les puedo ayudar. Justo hay alternativas que nosotros estamos brindando por parte del Colegio de Enfermeros acá de Lima Metropolitana en la formulación de diplomados a nivel nacional. Estos van a ser presenciales y también de manera virtual, ¿no? Y también nosotras como enfermeras que tenemos empresas, también nos dedicamos a la educación de más colegas, ¿no? Por ejemplo, dentro de la empresa que yo tengo, que es SCT Soluciones Empresariales, me dedico a dar mentorías de manera gratuita a más enfermeras para que puedan expandirse en este campo de salud ocupacional. Si bien es cierto, el campo de salud ocupacional es amplio, pero nosotras ya conocemos qué actividades, qué funciones va a realizar la enfermera ocupacional. Entonces, es por eso que nos dedicamos a poder enseñar a otras colegas a qué es lo que sí o sí van a realizarles en las entidades públicas y privadas, ¿no? Entonces, la pasantía que tenemos en salud ocupacional se apertura de manera gratuita, donde formamos, donde entrenamos a más enfermeras ocupacionales, y esta pues se da 2 veces al año, ¿no? Se da 2 veces al año y es para poder entrenar, educar y así, pues como enfermeras ocupacionales, poder seguir creciendo, ¿no?
Se la han formado como una comunidad en la cual se van dando apoyo y mentoría.
Exacto.
Ujú.
Es una comunidad de enfermeros a nivel nacional en la cual nosotros damos cursos, capacitaciones, también absolvemos las consultas porque hay enfermeros que trabajan ya en el campo de salud ocupacional, pero en un rubro, por ejemplo, minería. Entonces, a veces tienen dudas. Carmen, me preguntan, ¿no? Como enfermera ocupacional en minería, ¿me corresponde hacer esto o cómo puedo ayudar al trabajador si sucedió este evento, ¿no? Entonces, en cada sector se va a ir viendo diferentes necesidades. Ya nosotros como especialistas en salud ocupacional ya hemos abordado todos los sectores, por decirlo así, ¿no? Minería, hidrocarburos, transporte, sector público, administrativos, en hospitales también hemos hecho salud ocupacional. Y ya con toda esta experiencia, pues nosotros ayudamos a otros profesionales de la salud también, ¿no?
Gracias, licenciada Carmen. Licenciada Neis, ¿hay programas de mentoría en Colombia?
De mentoría propiamente, no. Sin embargo, lo que sí hay que decir es que Colombia ha sido pionera en la formación de profesionales en enfermería en salud ocupacional. Hace más de 40 años existió la primera cohorte de enfermeras especialistas en salud ocupacional. Sin embargo, al ver que era un tema que requería un abordaje más amplio, se crearon los programas interdisciplinarios en salud ocupacional, donde enfermería usualmente ha liderado estos espacios en programas de enfermería, de especialización o lo que corresponde en otros países con un máster y programas de maestría puntualmente que apuntan al tema de la investigación. Y, por ejemplo, a través de redes como la Red Internacional de Salud Ocupacional, se hacen acompañamientos y se participa de investigaciones a nivel internacional donde se pueda ir invitando a nuevos profesionales que quieran desarrollar estos escenarios. Una vez el profesional cuente con el diploma y cuente con la licencia, se vincula a escenarios laborales, tanto del sector público como del sector privado. Y en las universidades funciona el tema de los grupos de investigación y de los semilleros de investigación, donde los estudiantes tienen la posibilidad de participar de esos espacios y ahí sí, digamos que ahí existe la mentoría, pero más orientada al tema investigativo que incide en la salud y la seguridad de los trabajadores.
Perfecto.
Gracias.
Muchas gracias, licenciado Neis. Tenemos acá algunos comentarios. I'm checking the chat.
Yeah, I see there's one question, Dr. Novell, on AI.
Oh, yes. This is
Yeah.
for Miss Carmen. This is from another Miss Carmen Torres, a student from Specialty and Occupational Health. So, which advances we are getting in artificial intelligence related to common diseases or occupational diseases? Well, en realidad todavía se está avanzando en cuanto a la inteligencia artificial, ya se está utilizando para a partir de algunas ecuaciones poder llegar a la aproximación, digamos, al menos de sospecha o de tamizaje de patologías ocupacionales. No exactamente al diagnóstico, todavía se está avanzando poco a poco, ¿no? En lo que ya se ha avanzado más es en cuanto a la digitalización de la data, todavía en inteligencia artificial, por ejemplo, digitalización de la data, telemedicina, también en el uso de, sobre todo en las zonas remotas, utilización también de tecnología para lo que es inspecciones de seguridad y salud en el trabajo, para lo que es también los procesos de auditorías, incluso en centros médicos ocupacionales, en cuanto al uso de tecnologías en todo lo que es SST, ¿no? Aún todavía se está dando pasos poco a poco para lo que es el incorporar inteligencia artificial mediante la aproximación, al menos a la sospecha o al posible diagnóstico de enfermedad de la patología. Y luego recordemos que el nexo de causalidad, o sea, una vez encontrada la patología, el nexo de causalidad, ese sí es un trabajo que lo tenemos que hacer netamente los médicos ocupacionales, ¿no? Entonces, no llegar todavía hasta ese punto, aún no, aún hay un camino por andar, ¿no? Al menos en Perú. So what about in South Africa? Which advances have you seen in artificial intelligence incorporated into the monitoring of common diseases or professional diseases?
Dr. Penny, Kim?
I don't think there is anything specifically at the moment where AI is integrated in the diseases. I know that AI is incorporated in some of the tertiary institutions, and there are people working towards AI within occupational health nursing, and to look at the development. I know we have got a webinar that is going to take place on the 2nd of September, where the Academy of Nurse Excellence, Prof. Judy is also going to be there, and they're going to actually talk about it, but specifically in artificial intelligence within occupational diseases, and how that is going to go through. I'm not really privy at that, and I have not really been part of any of those collaborations, but I certainly do think that it is something that we need to look at, as AI is very prevalent in all spheres of life. So I would think that it is something that maybe also to look at collaboration or a research paper. Maybe Peru can also look at it from their point of view, and invite us if they can, or they have no, if they know more about it. Thank you.
Thank you.
Yeah, I don't think I've got anything more to add to what Kim said. Obviously, for me, I'm out of clinical practice largely, so my very, very limited knowledge on AI, and I sort of thought I'm past it. I don't need to get involved with it, but last year I was doing a locum in nursing education, teaching nursing education students. And so I did have to sort of hop on the AI board. And as Kim mentions, we've got in the Academy of Nursing South Africa, we've got a special interest group on AI and nursing. My interest is more on the education side, but obviously there are lots of clinicians that are interested in it from a practice point of view. Yeah, so I think it's sort of emerging in our country in nursing. I have a PhD student who's looking at it from an education point of view, and I have a chiropractic master's student who's looking at it more from chiropractic education. So more looking at the issues of using different AI applications for anatomy and physiology and those kinds of things. Yeah, thanks. But yes, as Kim said, if there's people who are interested, it would, or have got knowledge, we would love to hear what they've got to say, share some of their experiences with us, etc. Thank you.
Thank you, Penny.
Yeah, and Dr. Novell, if I can add, this was a presentation, an ICOH presentation webinar. Trying to think which country it was, but that was about a year ago, where they were basically talking about your wearing monitors. So simple things like your steps, the number of steps you take, the number of hours you're sleeping, the number of so it's monitoring devices that they then send the data to a cloud, and there's this AI component looking for trends. So it's a good thing in that we might not as individuals always have time to go to that depth of individual trends, and we always, not always, but predominantly looking at group trends. But it also, so the negative to that is removing the critical thinking from the practitioner on, an AI making a decision that this person has, if we just take, for instance, the step monitoring, when you wear your little Fitbit, away from the practitioner making that clinical decision. So the outcome or the message on that particular webinar was balance. Yes, make use of various AI software and things that are going to enhance your statistics and reports and things like that. However, you still take accountability for those trends and action that you take on that trend. Yeah.
Okay, thank you.
Mhm.
Thank you, all of you. Um, so it's been a very productive, useful, and unforgettable journey through this webinar. Muchas gracias a todos por su participación. Ha sido realmente muy productivo y un espacio muy motivador también, sobre todo por el rol que desempeñan todos las enfermeras ocupacionales. Ah, en 2 días justamente se conmemora el Día de la Enfermería Peruana y era el motivo por el cual también hemos organizado este webinar en colaboración entre ICOH Perú y el Comité Científico de Enfermería Ocupacional de ICOH. Es el primer evento en realidad que se lleva a cabo de esta manera, tanto online y con este enfoque, priorizando justamente por los enfermeros, las enfermeros ocupacionales. Así que esperamos que puedan participar todos en los siguientes webinars. El 11 de septiembre vamos a tener uno enfocado en lo que es educación y entrenamiento en SST. Tanto va a haber un speaker en medicina, un speaker en enfermería, un speaker en ergonomía, un speaker en higiene. Y el 18 tendremos un tema totalmente innovador que es sobre nanomateriales y salud ocupacional. Les haremos llegar la invitación con anticipación. Thank you to all of you. We hope you can join us in the future activities because we're going to hold another webinar this 11th September, focus on education and training, occupational safety and health, and 18th September, focus on nanomaterials and occupational health, which is new topic actually. It's not a new scientific committee, but a new topic which will be treated in Peru and Latin America. Happy Nurse Day, Nurse Day this 30 August. And well, thank you all of you for being part of this webinar. We will be sharing the recording by email, so please send your emails to both emails I have right in the chat. Por favor, todos pueden copiar o dirigir un email a los dos correos que he puesto en el chat para que podamos compartirles a ustedes luego las grabaciones de la presentación que también serán subidas en el canal de YouTube. Thank you to all of you and we hope to see you again soon. Thank you, Miss Kim, Miss Angie, Dr. Penny, Miss Carmen and Miss Onais. Hasta otra oportunidad. Gracias.
Thank
Muchas
you. Bye
gracias a todos. Hasta luego.
Adiós.
Thank you very much.
Buenas
Thank you.
tardes, gracias a todos.
Buenas tardes, gracias a todos.
Thank you.